Good morning. Good morning. So, here we are again, 2023 CCN Conference. So, I'm absolutely honoured to open this conference this morning here in not so sunny, but will be sunny Marlow. And as always, I'd like to start with a few thank yous. So first of all, to our strategic and conference partners who have most generously supported our annual gathering. Secondly, I'd like to thank our CCN officer team who organise our conference so diligently and support us superbly throughout the year. And of course, finally, to the politicians and the officers from our member councils. It is fantastic to see you all here again in person. So 4 years ago, we held our annual conference in slightly surreal circumstances in the middle of 2019 general election. Clearly, time flies in local government because this year's conference could quite possibly be the last one before the 2024 general election. As such, our gathering this year will undoubtedly have an eye on the future, as well as reinforcing the importance of positioning counties and their communities in the lead up to this election. But while this conference will make the case for counties as we count down to polling day, our network will retain a laser focus on the present. Because it is the challenges and opportunities we face today that will define the issues a future government must tackle. None more so is this true than in local government financing. This week, the Chancellor will set out his spending plans for the coming 12 months. In recent weeks, CCN has once again led from the front and laid bare the financial situation facing well-managed authorities up and down the country. Our advocacy has shown that although inflation is falling, it has permanently scarred our budgets. Alongside this, there has been a sharp rise in demand for statutory services post-pandemic. This has left our councils facing the prospect of overspending their budgets this year alone by a collective £639 million and budget shortfall of over £4 billion over the next 3 years. And the pressures are most acute in children's services and home-to-school transport. In children's, a severe shortage of accommodation and meeting the requirements of new regulatory regimes are conspiring to create a broken provider market in care placements. Councils have no choice but to pay spiralling fees to fulfil their statutory duties and protect vulnerable children. And in home-to-school transport, we face a rising tide in the number of eligible SEND pupils and heightened parental expectations for individual travel arrangements. Our new report, released ahead of this conference, shows CCN councils will spend over £1 billion on home-to-school transport this year, with the cost of transporting 85,000 SEND pupils increasing 33% over the last 2 years alone. And left unabated, send home-to-school transport costs for our councils will treble over the course of a decade. I know our analysis and the coverage that it's received has made Whitehall sit up and pay attention. But now we need action. On Wednesday, I sincerely hope that the government can provide at least some short-term financial relief to ease the pain. A failure to do so threatens the financial sustainability of well-managed, high-performing county authorities and raises the prospect of unpalatable cuts to service. It is clear, however, that this Chancellor, and indeed the next, face a tight fiscal landscape, and we cannot simply make blank cheque arguments. Requests for additional funding must go hand in hand with a programme of reform that can reduce long-term costs. This means tough but necessary decisions by both this government and the next. In children's services, for instance, we need to explore putting in place market controls around privately owned children's social care providers to minimise exploitation of a narrowly controlled market. Reform should include price caps for basic placements, strict requirements around notice periods, a cap on agency fees, and publicly available review of provider behaviour. And in SEND and home-to-school transport, we need to take difficult steps to stem the tide of demand, realign parental expectations, and review outdated legislation. Our report with ISOS Partnership sets out a range of practical reforms, including the introduction of a national means testing policy to focus limited resource on those who need it the most, and ensuring SEND tribunals do not rule on cases until there is full consideration of transport costs. However, these reforms will only go so far. Rising demand for SEND home-to-school transport is a byproduct of the exponential rise in EHCPs. The simple truth is the SEND system is not working for families, schools, or councils. Parents rightly concerned about their children's development push for the highest level of support or a special school place, even when this may not always be the right option. Schools lacking resources and bereft of low-level support are incentivised to compete for additional resources. And councils are left in the invidious position of managing down demand to reduce high needs deficits while having their hands tied by the tribunal process. The government's recent reforms set out in the SEND improvement plan earlier this year are indeed a welcome step in the right direction. The emphasis on early intervention, ensuring more children can attend mainstream schools by creating many more funded SCN places, and building special school capacity for those children who need it, are laudable aims. But it does little to look again at the little, but it does look to look again, but it does little to look again at the unintended consequences of the existing legislative framework, reform tribunals, and rebalance parental expectations. This means current reforms are unlikely to prevent our councils continuing to accumulate unmanageable high needs block deficits, while the system will remain beset with conflicting and misaligned incentives. So over the coming weeks, CCN will be concluding new research jointly commissioned with the LGA. This will set out the reforms the next government must undertake to make the system work better for everyone, parents, schools, and councils. But SEND is not the only area where we need to work with government and local sector partners to deliver long-term reforms. CCN has never been shy in setting out how councils can work better with other public service providers to integrate services and yield more effective outcomes for the residents we jointly serve. And today, I'm delighted that CCN is leading the way once again, publishing groundbreaking new research on how the NHS and local government can optimise hospital discharge. Last year, as we gathered for conference, we were at the beginning of what proved to be one of the biggest NHS winter crises to date. Such is the nature of these emergencies, short-term solutions were put forward to ease the pressure. This included a requirement to bulk buy residential care beds, not by councils but by the NHS. This was, in my view, in part due to a simplistic view of the cause often espoused by the NHS, framing delayed discharges as an issue almost solely attributable to a lack of capacity within social care. Today's new report shows that the underlying causes of winter pressures are more complex. Put together with strong input from health and care leaders, it illustrates how we can build a more effective system that works better for individuals requiring care, improves patient flow in acute health settings, and reduces costs. Rather than a focus on the purchasing of short-term residential care beds, it shows that we must prioritise investment towards community services, reablement, intermediate and home care. By working nationally and locally to implement the recommendations of this report, tens of thousands of patients could avoid going into hospital in the first place. For those that do, It shows both short-term and long-term outcomes could be improved and saving hundreds of thousands of bed days. I look forward to hearing shortly from the Care Minister, Helen Whately, who we're delighted to have with us this morning in response to those findings. I have set out just a few areas where we would urge this government to make more progress on over the coming months. However, we know that time is now ticking on the countdown to the general election, and CCN are already turning our attention to influencing the manifestos of all political parties. The needs of county and rural communities, the challenges and opportunities they face, simply cannot be ignored by any political party seeking to form the next government. As new analysis by Henham Strategy featured at this conference will show, of the 154 marginal seats in England, some 59 are in the 37 areas represented by our network. For my own political party, the numbers are even starker. Half of all Conservative marginals are in these areas. The 59 marginal seats stretch from the red wall to the blue wall, from north to south, east to west. They are key battlegrounds in which the next election will be fought and won. Put simply, counties matter at the next general election. So over the coming months, CCN will be doing all that it can to ensure our key messages are landed and acted upon in party manifestos. This will require detailed answers to the short and long-term reforms I have highlighted. But it also means taking steps to empower counties to be true leaders of place by devolving more powers and funding. There is no doubt that progress has been made here. Devolution deals in the East Midlands, Suffolk, Norfolk, and the North East are positive developments. Crucially, the Levelling Up White Paper, Devolution Framework, and the recently passed Levelling Up and Regeneration Act have put in place the foundations that all political parties must now build from. But ultimately, after a flurry of activity last year, no more deals have been announced, while promises to expand Level 2 arrangements have not yet materialised. I hope, and indeed expect, further progress will be made in the coming weeks on new county combined authorities and single county or unitary deals. In particular, these vanilla Level 2 deals can be rolled out quickly and at no cost to the Treasury, always a plus, and will provide a solid footprint for further and deeper devolution by the next government. Elsewhere in the conference agenda, we will also debate how counties must be at the centre of manifesto pledges to tackle the biggest issues facing the next government, whether that be the future of adult social care reform, where we must make the case for local government to remain at the heart of locally delivered services, how planning reform and house building can harness the strategic potential of counties, while ensuring we deliver vital infrastructure that enables communities to thrive. Building on LET transition to unleash the potential of county authorities in economic development, skills and employment, and providing local government with the tools to achieve net zero. In all these areas, I look forward to working with our member councils to put forward ambitious yet realistic and deliverable policy proposals. We will do so by building on our enduring strength as a cross-party network that time and time again punches well above its weight, whoever is in office in Whitehall. CCN has once again this past year reinforced its influence as a respected advocate of members' interests. Its research has produced impactful reports on the challenges and opportunities facing all of you. It is recognised as the voice of counties and unitary authorities, while increasingly leading on behalf of the entire sector. It has delivered extensive support to members who are on challenging transformation journeys. CCN is your organisation. CCN is your voice. CCN is absolutely there for you. I hope you enjoy the conference. Thank you.
fade softly into the background. Good morning, ladies and gentlemen. I think most of you will know me, but I'm Martin Tett. I'm the leader of Buckinghamshire Council, but for the next couple of days, far more importantly, I'm the social care spokesperson for County Councils Network. In this particular session, we're going to follow the particular theme that was in Tim's speech, which is we're heading now into another winter. And we know what will happen because it's happened almost every year I can remember, which is there'll be an NHS crisis. You know, we will see all the media reporting on full hospitals, elderly people stuck, unable to get out, and invariably the finger will be pointed at local government. We will be the scapegoat for all of the problems in that system. Now, having seen that last year and having, as Tim mentioned, had the situation where there was a big basic dollop of money given to the NHS to bulk buy beds and that being seen as the solution, which of course it wasn't and proved not to be, what we want to do as CCN was get ahead of the game. So we've commissioned Newton, and Danny is sitting next to me here. Danny is the director that's led this work, to actually look at not just the symptom, which is the congestion of getting people out of hospital, but to actually examine what the overall problem is. So we ran a series of workshops over the summer where we had all the various parties across the system, the NHS, care providers and so on, including the Treasury, interesting enough, around the table, to actually examine the system right from who should be going into hospital in the first place and were there alternatives, how people progress through the system within the hospital, the process of discharge, how effectively that works, and then also where people should move on to, and is it always the right thing to do to put them into effectively a sort of an intermediate care where actually they can end up getting stuck as well. Now, the results of that work, Danny is going to take you through in a second, and then we're going to ask Helen, as the Minister of State for Care, to respond to Danny's report, and then we'll have a panel session where you can ask questions to either Danny or to Helen. I'm just going to say Helen is time limited this morning, so she is going to have to leave. So if you have questions particularly for Helen, I will take those first, and then she can get the opportunity to respond to you. Hope that's okay. So having said that, Danny, over to you.
I'm hoping I've got slides, just slightly pause. So there we go, good news. Morning everyone, and thanks for having me here. I'm Danny, I led this work on behalf of Newton, and it's our pleasure as always to be invited to join you at the conference. As Martin said, I'm just going to maybe spend 10 or 15 minutes talking through some of the headlines that have come out of the work. There'll be an opportunity at the end to make sure that everybody sort of has a full copy. But yeah, share a bit about the scope and share some of the headlines in terms of the kind of key analysis, key recommendations and conclusions. Click on one, have I got the... Sorry, there we go. That was the bit of the rehearsal we didn't do, so we're set. So I think the headline message, though, going into this, and I think it alludes to the points that Martin's made and the point that Tim has made, the system as it is currently is not achieving the kind of best outcomes that it could for older people. So for people who need urgent and emergency healthcare services, the evidence points to a system where people are being admitted, where they don't necessarily need to be admitted to an acute hospital, experiencing delays during their stay in hospital, both during their treatment, but also when they're kind of waiting for onward care and support. And there's also some clear evidence that long-term people aren't then getting the right care and support after a stay in hospital. And suffice to say, and everyone will know this, spending longer in hospital than you need to is not a good thing. Creates operational pressure for all the organisations involved, introduces significant additional and unnecessary cost, but above all, it's a bad outcome for the person, and there's some good research included in this paper which talks about some of the effects of that, including effects on mental health, effects on deterioration, and the increased likelihood then of someone subsequently being readmitted. As both Martin and Tim have alluded to, last winter was really hard, really hard, and it's clear that since then we haven't fixed everything. We are looking ahead to another really challenging period of time. This piece of work was commissioned coming out of that winter, and where we'd seen the legacy of COVID-19, we'd seen staff shortages, as well as just the general seasonal pressures, things like flu, all being evident and all layering on top of each other to create something that was a real challenge to work within and to be someone receiving services during that time. So and as I said earlier, as well as those individual outcomes and the outcomes for people not being where we'd like them to be during that period, it's created significant additional cost and operational pressure across both the NHS and across local government. So the scope of this work then, the ask really was, can we explore opportunities to improve those long-term outcomes for people, to prevent, reduce or delay need in the first place and the need for hospital care in the first place? And also then look at when people are being discharged from hospital, how do we get the right support around them and get them back home as much as possible. 3 sections, and I'll mirror these just in the presentation now. So a brief overview of the current challenges and some analysis to support that, what then we think is driving that and what some of the root causes are, and then moving on to conclusions and recommendations, both in terms of things that need to be, we'd ask to be taken forward centrally, as well as things that local systems themselves can take forward. Very briefly, in terms of the methodology, heaps of evidence gathered, both using national data, specific data returns that, again, many of the county members in this room were generous with sharing with us, as well as experience from Newton's work up and down the country doing change programmes in urgent emergency care. And then supported and led by an expert advisory group. We had Martin chairing that, and you can see the organisations around the outside, and Rachel on behalf of ACCI. But I think 2 important points to draw out on this. So this work's been cross-sector in 2 dimensions, if you like. So you'll see NHS Confed and NHS providers on there who were a great contribution and supported us in making sure that what came out of this work was wholly supported by the sector, as well then as support between local and central government. So again, we were really pleased to have Department of Health and Social Care and Treasury contributing to this work, and really pleased that Minister Whately's here as well today. And just a last point before I go into some of the headlines, you bear with me whilst I talk about things like patients and flow and discharges. We've held on throughout this to this work being about the person in the middle of it all, and come back to that point I made earlier on. You know, spending too long in hospital for an individual is not good for their long-term health, care and well-being. And that's really been the principle that we've tried to build this work around. So an analysis of the current challenges and what we've experienced both in last winter and since then. Bear with me, there's quite a bit on here, and I'll just draw out some key headlines. And if you work left to right across the page, so over on the left-hand side, that's starting with when people are being conveyed and attending hospital in an emergency. So we've seen a 6.2% increase in people attending hospital, and a significant, the 35% increase below that, in terms of those category 1 calls to paramedics. So we can see significant additional volumes of people at least attending accident and emergency. Moving across one though, we see actually that we're maintaining quite good levels of triage there. So we're actually seeing emergency admissions growing much more modestly, 3.8% growth from last winter versus the one before. And again, many of you will have experienced this in your own places. We are confident that people are more unwell. You know, this has been an anecdote that we've heard a lot, and I think for the first time, certainly as Newton, we managed to get some data through this work that demonstrated people are more unwell. They're coming into hospital with more comorbidities, more complications, that therefore means that treatment is more likely to take longer. And the point at the bottom, I think, is really important. So whilst emergency, we're seeing more people in an emergency, actually the total number of people coming into the hospital is still less than it was before the pandemic. So again, with the elective backlog that you'll all be well aware of, we're seeing still that the total numbers of people coming in are less than they were. We're seeing people spending longer in hospital, so significant increase of about a third on length of stay. That's both before someone is medically fit, so when someone's being treated, but also after, once somebody's become ready to go home. And you can see, again, I won't go into all the specific figures there, but you can see some of the specific figures in terms of how that's grown. And then over on the right-hand side, we've seen, at the point then people are leaving hospital, we're seeing more people benefiting from intermediate care and enablement services, which is really, really positive. The slight downside to that is we're not seeing the reduction that we'd expect then to see in terms of long-term care and support. So 7.9% increase in people leaving hospital and going on into long-term care and support, residential homes, nursing homes, which obviously, again, the cost is borne by everybody in this room. So I'll just draw attention to a couple of those points very quickly to illustrate the overall picture. So again, that's just a chart of hospital occupancy comparing the most recent winter period to the one before. So you can see stepping up by about 3 or 4 percentage points. And then that point again about ongoing care post-discharge. So The yellow represents residential care, the red represents nursing care, and the blue represents long-term care in the community. So we can see we're on this trajectory of people generally needing less care and support when they left hospital, and that has reversed in the last couple of years. So that's, again, we're seeing that increased cost and increased pressure coming into local government. And then just, again, reiterating the point around admissions. So the red along the bottom is emergency admissions, and you can see really that stayed pretty flat. There's a little bit of growth in there, but it's only really in line with demographics. The non-emergency admissions still remains below where we were before the pandemic. So the pressure is not coming through because we're admitting more people, but we are seeing it both in terms of, and that's the chart at the bottom just showing that increase in acuity, and the chart at the top there showing that people are staying for longer when they are coming into hospital. So, fairly challenging picture, but the good news is there's lots going on behind that gives us some confidence that there are some solutions. It was a great privilege in this work to see great case studies from up and down the country where people were making really, really brilliant progress. And I think that one of the main questions that this report's tried to grapple with is how do we take what's going on, which is really brilliant in some places, and how do we scale that up nationally and support other health and social care systems to adopt some of those really good practices. So again, I'll deliberately bamboozle you with 17 different numbers, but again, just work from left to right and draw out a few which hopefully bring this to life a little bit. The figure, the 31%, that's those attendances at hospital that I alluded to before that we think could be avoided. So when we've looked back through, a couple of thousand examples, had a multidisciplinary group help us with that, we think they could be avoided. There's alternative community services that would have been a better solution for that person rather than going along to A&E. And that translates into admissions as well. So the 30% at the bottom is the admissions that could have been avoided for older people. And the point in the middle there really, really important. So we're saying about half of those avoidable attendances came via ambulance conveyance. So that's where paramedics are bringing people in. And we're starting to see some really good practice again up and down the country where we're having social care teams effectively intervene on ambulance calls, which starts to address some of this challenge. So some really good practice that has the potential to tackle that. Move across to the right. So before someone's medically fit for discharge, some of the delays that we're seeing there. So just over a third, 35% of the time for an older person when they're in hospital before they're medically fit, that's time that's made up of avoidable delays. The really big things we see driving that, waiting for diagnostics, waiting for scans, waiting for x-rays, waiting for MRIs, but also 40% of the time waiting for decisions from medical staff. And again, that can be waiting for the final, medically fit decision at the end. And there's a good bit there, which is again some of the more innovative work in terms of role of virtual wards, people being able to receive IV antibiotics at home. That's not a reason we need to be keeping people within hospital. And coming across to the right-hand side, so Tim made this point around what are called simple discharges, but what that means is effectively where somebody comes into hospital and then goes home with exactly the same support as they had to start with. So either nothing, because they were living at home independently, or with whatever the same support would have been. We think that as an individual pathway is the single most significant cause of loss. So every simple discharge is delayed by somewhere between 1 and 3 days. And what we really see there is a profile through the week. So we see real reduction Friday, Saturday, Sunday, which is what's sitting behind that. So 1 million bed days there in terms of lost time in hospital to people who are just going home with, say, it's a simple discharge. In terms of what we talk about as complex discharge is usually where social care or some form of ongoing care and support is required. Again, lots within all of that that we could pull out, but you can see some of the headline kind of delay figures there in terms of, on average 10 days delayed for somebody who's waiting for a residential placement, 5 days delayed for somebody who's waiting for a short-term bed, and then 4 days delayed for somebody that's looking to go home with home care. So significant progress that can be made in both fronts there. And then lastly, all the way over on the right-hand side, significant number of people that would benefit from that home-based reablement and rehabilitation, again, that Tim referenced, and that's one of the kind of key things coming out of this work is to try and support investment to develop the capacity in those services. And particularly in short-term beds, again, Tim alluded to, where last winter we bought up lots of beds. What we've seen then is people get stuck in those beds for a really significant period of time, and we're seeing only 11.6% of people are actually leave those beds when they're ready to do so, when they're deemed medically ready to do so. So therefore, how do we take all of that and look at scaling it up? It looks incredibly simple when you just trim it down to three headings on a page, but we're not claiming it is this simple, exactly to Tim's point, but just as a by way of framing. So there's a set of recommendations around how do we avoid some of those unnecessary admissions. There's a set of recommendations around reducing the unnecessary delays for someone that is in hospital, and then a set of recommendations about how do we optimise long-term care for people once they're discharged. Significant financial impact, as I've said throughout, if we get things right for people going through this system, then there's significant financial impact for both local government and the NHS. So again, these are all just kind of crudely summarised, but 175,000 fewer adults could be admitted. That represents about 1 in 10. That primarily is about, again, thinking about the paramedic figures that we showed you before, making sure people have got awareness, trust, access to some alternative community services that could benefit from, which people could benefit from instead of being admitted to an acute hospital. In terms of when people are within hospital, there's, again, we think at least half of those sort of simple discharge days are addressable at the top there, and that particularly is looking at that flow through the week and how we can get people discharged regularly over Friday, Saturday, Sunday, Monday. In terms of the complex discharges, that's really making sure, and that's our sort of people who need ongoing care and support, so that's making sure really we've got the right capacity of intermediate care and step-down services, and again, that point about having home-based reablement is really, really important. And then lastly, in terms of ongoing and kind of long-term outcomes, so we think there's a whole group of people, that's sort of 43,000, who we're making a decision at the point of discharge that they need more care and support than actually would be optimal for them, so we're perhaps sending them to a residential bed when they could be going home. So that's about decision-making and confidence with our staff. And then on the right-hand side, that's the opportunity in terms of investing in that home-based reablement that we talked about at the beginning. So very quickly, I'll just cover off some of the headline recommendations, which again, hopefully you'll see we'll link back before I hand over or hand back to Martin. Centrally, then there's three big things that we really want to make in the short term, and I will focus mainly on the short term, but again, there's lots to be said in the long term as well. That first point about we need, if we're going to grow the capacity in intermediate care, it really needs to be home-based intermediate care, reablement therapists who can help. That 40,000 figure from the previous page, those are people that would really benefit from those sorts of services. And then 2 and 3 are really about getting admissions avoidance and simple discharges up on an equal footing almost in terms of the narrative with people that are waiting for social care. Because we think, again, there's really significant opportunity to improve on both of those, and we want to make sure those become part of the national narrative. I won't go through the long-term recommendations in detail, but really a lot of that focuses around access to data that people trust. So the number of times we spoke, and we probably spoke with 100 or more different people through doing this work, one of the biggest things people said about limiting their opportunity to implement and improve some of this was we don't have data that we trust as a system. And that was a fundamental thing that wasn't in place. And then very lastly then, so for locally, so if that's what we need from central colleagues, what can we do locally? That point about what else is available in the community and supporting people to be able to have visibility, trust and confidence in that is really, really important. Focus on the simple discharges. That can be a difficult conversation to have with system partners, but is a real significant opportunity. And the other one I'll just draw out again, as you'd expect, is prioritising building home-based intermediate care and reablement services. And again, long-term recommendations really do focus about getting good quality data that the system trusts that can be used to drive commissioning. And at that point, I will stop talking, hand over to Minister Whately and to Martin.
Thanks very much, Danny. Can I just say the full report is available. It's a lot of detail in there, and it's a terrific evidence base behind everything that Dan has just outlined there. Helen, just you to respond. Thank you.
Thank you very much. As you'll see, I've crutches and things with me today. I take my job as a health minister very seriously, and that means making sure I check the services are there for everybody and using them myself. So good morning, everybody. So I've been care minister for a while, And if there's one thing I know, it's that I know I don't have all the answers. The good thing, actually, is that the answers are out there. In fact, many of you will know many of them. And when we bring data and insights together, as the County Councils Network and Newton have done in the report that Danny just talked through, an apparently impossible to solve problem can become possible to solve, though not necessarily easy. I think the excellent report that Danny's just summarised addresses two things that I really care about. Firstly, time spent in hospital when it's unnecessary and can be harmful. And secondly, the poor use of resources like NHS staff, beds and ambulances sitting outside A&E that happens when people are being unnecessarily admitted or not discharged as quickly as they could and should be. And these things affect the affordability of our health system, but again, that can lead to harm as pressures mount and beds and ambulances become in short supply. But on the other hand, if you get this right, you have better care for people and you avoid harm and our health system becomes more affordable. Now, I really care about these things because they affect so many people. The report brings us to life in case studies. It talks about the stories of Rashmi, Stan, Jean and Reginald, if you read it. But it's also personal to me. My grandmother lived to be 100. When she was 100, she was living pretty independently in her own home. She tripped over. She got a bad bruise. There was, unfortunately, a catalogue of mistakes that led to hospital admission for her. She then spent 5 months in hospital. Numerous attempts to discharge her failed, and when she was eventually discharged, she was bedbound, and 2 weeks after she made it home, she died. So that is what 5 months in hospital did to my independent and astonishingly healthy grandmother. I also have a personal story about what happens when hospitals are full and ambulances get backed up outside instead of being able to respond to emergency calls, but I will spare you that one for now. But suffice it to say that when the system isn't working, I do know what it does to people, and I do truly care. That's why when the Prime Minister appointed me just over a year ago, to do this job, I actually volunteered at the time to have oversight of hospital discharge processes as well as social care. And I've also since taken responsibility for urgent and emergency care, or UEC. Now, I'm heartened that since I've been in this job, as the report indeed says, thank you, Danny, this work may be starting to pay dividends. And that was particularly on the discharge side. Before I delve further into this specific topic, I just want to go back a moment, because I know very well who I'm talking to today. I know that in this room we have elected representatives and officials from County Council who provide social care, so you're not in the main and NHS audience. A lot of this conversation, though, is about social care and the relationship between social care and the NHS and helping people get out of hospital. I just want to assure you that as Social Care Minister, I actually see social care as an end in itself. I don't see it as just existing to help the NHS. The join-up is really crucial, but I know, as you will know, that most of the social care that happens in our communities is not about the NHS. It's about helping people live their lives day to day to the full, whatever the challenges they face. With people living longer, with more long-term conditions, more people are living with more challenges, and that, of course, puts more demands on our health and care system. And we saw, as already been said this morning, that system really struggle last winter, as Tim said. And actually, as Tim, I think you also alluded to, the government was criticised for the response being too late and not necessarily the ideal response. That's why our urgent and emergency care recovery plan and our preparations for this winter started all the way back in January, when we were still in last winter, and we got together and we said, how can we make sure that the next winter, this one which is just upon us, is different? That UEC recovery plan you can in essence summarise as doing more, so boosting capacity in the system across the NHS and social care, doing things differently, firstly changing the way we do things to reduce lengths of stay in hospital and discharge people when they are medically fit for discharge, and change the way we do things to keep out of hospital in the first place. And I'll just run through a few of the things that are going on and have been going on during this year to get us ready for this winter. So on the first, on boosting capacity, this winter there will be more hospital beds, around 5,000 more ambulances, 800 new ambulances coming onto the road, and more social care, which many of you will be part of. So that's helped by this year's 600 million discharge fund, the 570 million MSIF workforce fund, and an additional 40 million UEC social care fund, particularly targeted at the systems where there are greater challenges on the NHS side. On the second part of the plan, on the changing how we do things to help discharge people quicker, I'll just give you some examples. So we now have over 10,000 hospital at home or virtual ward beds, which help reduce the length of stay for patients in hospitals, help people recover at home. I know sometimes I encounter a bit of skepticism about this, and is that really the right thing for people? The patients that I talk to who've been discharged through virtual wards have given me really, really good feedback at how they would much rather recover at home, can recover better at home, but with the backup of the clinical teams that were helping them in hospital. We now have care transfer hubs in every system, bringing together everyone who needs to be involved in a complex discharge. I know some are more mature, shall we say, than others, but those exist across the country. We have system control centres bringing together capacity and activity data so we can see what's going on better. We have the intermediate care framework, which sets out what care people should receive when discharged. And then on the final of the kind of three areas, changing how we do things to crucially keep people out of hospital, because we all know that if a hospital admission is unnecessary, it's much better to avoid that admission in the first place. We have, among other things, community rapid response services, which are reducing ambulance conveyances to hospital, acute respiratory hubs, same-day emergency care services alongside EDs. We have, in some places, care coordination teams, as in fact the report describes in Leicestershire, Leicester and Rutland. And again, in some places, and Hull is a great example of this, proactive care neighbourhood teams who've identified the people in any community most at risk of hospital admission and put care and support around them to reduce the risk of that admission. And all that is underpinned by more joined-up planning with demand and capacity plans for each integrated care systems across health and social care. I suspect some of you may have been involved in the work that went into those, for which I thank you. And we have better data, including new discharge metrics. And earlier this month, we published for the first time, the NHS published for the first time, the new discharge metrics showing the length of time between discharge ready date and discharge, which we intend to publish also by a local authority, and we want to build on to have better data about the reasons for delays, which will help shine some of the light on some of the things that Danny was talking about in his summary earlier. I do know that all this is making a difference. For instance, I am assured that there is a much stronger supply of home care, and in many ways, shorter waits for home care, or in fact, many places, no wait at all. During this year, we have seen an improvement in the no criteria to remain figure. It's not the best. It's not a perfect metric, but it has been what we've had. Currently, there's an extra 1,000 beds freed up in the NHS this time compared to last year as a result of all the work that's been going on to improve discharge. We've seen ambulance response times improve. They're about 19 minutes better this time compared to last year for Category 2 ambulance responses. And we've seen performance in emergency departments improve despite emergency departments seeing more people. And we know that many of the actions I described a moment ago are successful, both at reducing length of stay and avoiding admissions. So we are reducing harm and improving the use of resources. But clearly, the job is not yet done. Why not? Well, these are complicated problems to solve. In fact, I think some of the many facts and figures on Danny's slides help to illustrate the complexity of that. Doing things differently isn't always easy. Everyone feels under pressure. I've no doubt you are feeling that in your areas. That said, I do have a couple of requests for you, in fact 3. Firstly, on data I know that collecting data is a burden, but clearly without data, we can't know what's happening and we can't know what is working. And in social care, we do need to get better at collecting data so we do know what is happening and we do know what is working. I also have to explain to the Treasury and ultimately to taxpayers, quite rightly, where the money has gone. And that is why I ask you for data. So I know, and I hear it through officials sometimes, kind of some sort of pushback on all the data that we ask for from the department. And I do appreciate the burden, but I ask for it with, I believe, good reason. Secondly, I have an ask on planning and commissioning. So for this winter, I asked to see in advance what demand for social care councils were forecasting and what care had been commissioned. And I asked that because I don't want to find ourselves in January suddenly finding that we're under a huge amount of pressure and that there isn't the supply of home care, for instance, to support either avoiding admissions or discharges from hospital because that home care hasn't been commissioned, and then at short notice, home care agencies clearly can't suddenly recruit a huge number of staff over Christmas and early in the new year. So that's why I asked for that in advance, so that would be commissioned in advance. And my request on this to all councils is to keep on looking ahead and do what you can do, and I appreciate your financial pressures, to make sure that the supply of care is there for people who need it, clearly working with care providers to make sure that they have the staff they need. And that means making sure the providers that you commission care from are really looking after their staff in these difficult times, for instance, giving them paid travel time, giving them the support they need on difficult days, and indeed encouraging them to get flu and COVID vaccinations, which can make such a difference to the supply of workforce if we have a surge in flu, for instance. And my third and final ask is that we keep working together on this, together with care providers, the NHS, charitable organisations and carers. It was great to see, Danny, your report brought together a lot of different representatives across those sectors. There's a lot of things happening to make a difference, but these things aren't happening everywhere, and not everywhere is doing everything that can possibly be done. And I think with the challenges we face as a system, the onus is on us to try and do everything that we can. My commitment to you is that I will keep on working at this, and as I think all of you who know me will know, that I'm not in the business of pointing a finger at social care. I think, Martin, you mentioned social care sometimes being blamed for delayed discharges from hospital. I appreciate that it is a much more complicated picture than that. And I assure you that while I may ask a lot of you and of the social care as a sector, I will myself stick up for social care. Just before we go to questions, I will return briefly to where I started. As a government, we are putting more money into the NHS and more money into social care, but on its own, that is clearly not enough, and nor actually is it on its own the right answer, because as well as doing more, we have to do things differently. I've talked about the risk of harm to individuals, the strains on the whole system. I'm sure we all know about that, but when we get this right, we know what that is like too. It's not just about people spending less time in hospital, it's about people retaining and regaining independence to live the best life they can. It means someone waking up in the morning in their own home, surrounded by familiar things. It means smiles and hugs and laughter. It means people living more of the life they want to live, even in the face of frailty. Thank you.
Helen, thank you very much indeed. We've got time for some questions. Although I know a lot of people in the room, can I just ask, when you ask your question, can you just say who you are and where you're from? Because that will help both your colleagues in the room and it will help Danny and Helen actually understand a little bit of the context. So I'm not going to take the obvious suspect, which is David down here, who's an expert on the topic. Can I take Sam first of all? Try and get some.
Hello,
ladies.
I'm Sam Corcoran, leader of Cheshire East Council. The question is about last year when we had competition between the NHS and councils for care home beds. How do we make sure that doesn't happen again this year? Because last year it simply boosted the prices rather than boosting supply. And I was pleased to hear Home First is definitely part of the answer in the virtual wards. But I'd like to know how we make sure that doesn't happen again this year.
If we do quick questions and quick answers, I'll take them one at a time. If we get into groups, we may have to do that in a minute. But Helen, do you want to respond to that maybe?
Do you want to do
Well,
that one?
do you just answer that one?
Okay,
and then
that
we'll
one.
take some single questions and I'll move on to some groups.
I mean, our approach this year is different from last year. And one of the things I heard about last year was that the funding came too late. And clearly, the way it was set up, as you say, didn't necessarily work as well as it could have done across the system. This year, the funding has already been distributed, particularly the 600 million discharge fund. And for next year, that's £1 billion coming in the discharge fund. So that was to enable systems to plan ahead. And I hope what you've seen is, I certainly pushed really hard for planning to be done jointly within integrated care systems, and joint capacity plans, and joint working out, well, where's the demand and what capacity do we need across health and social care to meet that. So that's the way I've set it up. Inevitably, and I've tried to enable or encourage, there will be variation between systems, and you will tell me, I'm sure, that some places you have good relationships and others you won't, and people work differently. But what I certainly have intended is the way that we have done things this year is different, and therefore doesn't set up the dynamic that you described from last year, Sam.
I'll just support Sam. That's exactly what happened in our area. The danger is the NHS go out to buy beds, we go out to buy beds, and we compete against each other. The price just goes up. Yeah, move on quickly.
Alan White, Staffordshire. Did your report look at clinical risk aversion in determining the flow of patients through the system? Paramedics turn up at a house and choose to convey because they don't want to make a decision. Junior clinicians at A&E choose to admit because they don't want to make a decision. And the fit for discharge process, there's about 6 or 7 people who've got the power of veto on discharge, which actually causes much of the delay. If we could... Yeah, okay. Did you look at the risk aversion?
Yeah, if we can keep the questions really concise, that will really help get through some. Thanks. Do you want to respond to that as well?
I can respond. The question was, did the report look at it? But I can give a government view as well.
Give a government view, and also, Danny, did you look at it? And then quickly back to Helen in terms of...
So short answer is definitely yes, exactly in all the areas you've described. And I just, so absolutely with paramedics, absolutely with medical colleagues at the point of admission, absolutely around discharge. I think just the other point is that we talked about the Pathway Zero. I think one of the great opportunities there, rather than say we have to have another big drive on 7-day working, is about criteria-led discharge, which is about a medical senior being able to say, if A, B, and C are true, then this person can be discharged by a healthcare professional as soon as those things are true. I think we're seeing really variable consistency around that. I think that, as far as there are silver bullets around these things, I think that's a major opportunity, but needs the clinical risk aversion addressing to enable that to happen.
Variable consistency, right.
I mean, certainly it's a conversation, Alan, that I've been part of some conversations about this kind of at the centre, and recognising where, on the one hand, concerns about risk, and then you get risk in other bits of the system where kind of nobody's there in a sense. So trying to get a kind of shared risk across the whole pathway that somebody may follow. And so those conversations are happening, both led by the NHS and also trying to get in the sort of integrated care systems, bringing together social care, local authorities, the NHS, and to look across the whole system. So that bringing together is trying to enable that looking at risk all the way across the system. Again, not easily answered, but definitely something that we are aware of and try and help with.
Right, can we try and squeeze in another couple of quick questions? So, gentleman there. And then the lady at the back up there.
Pete Sudbury, Deputy Leader of Oxfordshire County Council. In my last life, I was a psychiatrist for over 30 years, and I was a medical director for 12 years, and discharged lots of patients in the community. I've heard this before. I've seen all this and all the answers before. That was how does it get different this time? How you assure me I won't hear it again, short of assassination. And secondly, where is primary care in this?
Two quick questions. Do you want to, I'm just conscious Helen's time is very limited, and do you want to take a stab at that? And I'll ask Danny as well.
Yeah, I mean, I think people have been looking at this problem for a long time. I was aware of it years before I was a member of Parliament, for instance, and so no one would suggest that it is easily solved. I think different things are happening. I think a whole set of things are going on across the country which weren't happening before. Some of it is clearly about where other places are not doing it. Well, can you get them doing it? The care transfer hub model, looking at the ones that really work and getting others to be more like them. I think we do have a more joined up system. And I feel as a minister, even in me, I have oversight of social care, but also discharge. And so I'm seeing the whole flow. And with integrated care systems, again, those can bring organisations together to see the whole flow. It's not going to change overnight. These things are hard and complicated to fix. But just because it's been a long-running problem isn't a reason to say we can't do it. In fact, all the more reason to say we can.
Danny, a very quick comment, and then I'd like to take the lady at the back, and I think we're probably out of time at that point.
Really quickly, and happy to speak more about it separately. I think that's exactly what the central recommendations are designed to say. We see pockets of brilliant practice where all of this is coming together. Why don't we see it consistently nationally? It's trying to, which is why we talk so much about data and a single version of the truth. As I say, I think every system we spoke to said a version of, we don't have a view of data in our place that we trust, which therefore how can you implement some of these things? Primary care, certainly in every one of the, I described as looking at thousands of cases, there would have been some of them primary care as a minimum in every one of those conversations, but we can, again, I can talk in more detail.
So get me going on primary care strategies. It's a big topic. The lady at the back, and then I think we're out of time. Tim, I'm just looking at the clock.
Thank you. My name's Amanda Jupp. I'm the lead member for adult social care at West Sussex County Council. Is there any merit in upskilling paramedics more and giving them the authority to go direct to social care or local community networks? Thank you.
So one of the good things that we're seeing going on is community response services, and that's often coordinated by ambulance trusts, where they're doing a really good job of not conveying people to hospital when they don't need to. And one of the things we see, and I think actually your report probably highlights this, is when those teams really know what all the alternatives to hospital are, then you're also much less likely to have somebody conveyed. So I think things are going in the right direction on that. And again, like many of the things, it's getting everywhere to be as good as the best at that.
Yeah, it's consistency across the country, isn't it? There's some great exemplars, but then there are some that are not driving that through. Again, do you want a very quick comment on that?
Just say, I think it's a really good thought. I think one of the points we referenced, one of the case studies about where we've got urgent community response and social care effectively incepting paramedic calls, which is to some extent another angle on a similar challenge. So, but I definitely think there's merit in it, and I think there's some good case studies in there where people are doing things differently with paramedics, which we worth looking at.
Ladies and gentlemen, colleagues, we could probably talk about this topic all morning. I'd love to, actually, but the clock is against us. I'm conscious, we're eating into the time for the next session. So can we just put our hands together and thank Danny and Helen for the time they've given us. Thank you so much. I really mean that. Really, really mean it.
spokesperson. This plenary session is about the impact of COVID and socio-economic trends. So we've just heard from Minister Whately about the importance of data, and that's a really good segue into this session. We're looking at some of the big questions. Has COVID led to changes across society? Has COVID changed the economy? Has there been demographic changes in our council areas? Are there long-term health impacts affecting the workforce? Can big data help us inform our policy decisions? Do we have to adapt council services to meet the new needs that these socio-economic changes are creating? So to help understand the reality of what is happening, I'm delighted to welcome Deputy National Statistician and Director General for Health, Population and Methods at the ONS since July last year. Emma has also been the ONS Director of Health Analysis and Pandemic Insights, Director of Public Policy Analysis, and before this, Director of Intelligence at the Care Quality Commission. So Emma brings a wealth of understanding on topics that matter to us. Over to you, Emma.
Good morning. Thanks very much for inviting me to be here. It's a real privilege. And I'm hoping that you're all die-hard data fans, which is why you're here. I'm going to take that ripple of chuckling as yes. So I'm going to run through a few slides relating to what we have observed from the census data. In the app for this conference, you should have a link to our site. Now, some of the questions that the councillor very kindly introduced me with for this purpose of this session, I'm not going to go into each one of your areas and tell you the answer to all of those questions. But I am going to give you some tools and hopefully a bit of support in being able to identify where the material, some of the underpinning evidence that we obtained from the census can be found. It's available on your smart device as well as your laptop. If you want to Google census maps or build your own local area profile with the census, you can take a range of different variables. And I'll show the different tools in a little while. But this is really about sort of helping you get some sort of high-level messages from the census. And then I'd also really like to talk about where ONS is going with population statistics. We recognise the limitations of the census. We've recently concluded a consultation on the future of population and migration statistics. Some of your areas will already be working with us on this direction of travel. So I'm going to update you on where we are with that. So, very quickly to set the scene, the ONS is part of the UK Statistics Authority. We're a non-ministerial department. Our purpose is to create statistics for the public good. We don't exist for our own intellectual pleasure. That is merely a byproduct of the work that we do. We're here to create information, insights, things that allow you to improve the precision of your decision making. But I'm not going to pretend that that's not hard, but that is the pursuit of all of our work, and our collaboration, therefore, with county councils, with local authorities more broadly, is really critical in delivering that. So, putting evidence into the hand of decision makers, as I said, we are increasingly aiming for that endeavour to be much more precise. The census gives us a snapshot. It's a fantastic snapshot. We had the greatest response rate in 2021 than we've ever had before at 97%. But in between censuses, we see what we call intercensal drift. We see internal and international migration shifting the patterns of the population. We see the shifts around how we can describe society. So our recent consultation that I just referred to is aiming to increase the granularity and frequency of high-quality statistics that shape our understanding of society and the people that we care about, that you provide services for, and that we interact with on a daily basis. That it's sustainable and future-proof, and I'll talk a little bit more about novel data sets. You may have seen recently in the press that we've just come to an arrangement with Airbnb to share their information. Increasingly, the internet and digital services have a data set that we are able to acquire and make use of for that real timeliness. But we've got other data as well. And the flexibility is key. The tools that I referred to, from which we can derive greater insights from the census, is really only the part of it. You know, I think thinking about the citizen at the heart of this work, thinking about what do they need to know and how they can better interact with services, is something quite exciting. But the flexibility of the data that we have, its ability to speak to all layers of decision makers, no matter where you stand in society, is critical. So you may already be familiar with our regular offering, but just again to set the scene, if you're not in regular conversation with ONS, we have a number of different teams across the organisation who link to your constituents and beyond. We've got 14 pilot local authorities, some of whom may be represented here, where we have a particular in-depth relationship with developing new methods and understanding uncertainty of those methods, which I'll go on to. We attend local area research and intelligence meetings, and we run census advisory group meetings for local authorities, both in England and Wales. And we have the Central Local Information Partnership. We have a population subgroup meeting that offers a series of forums to enable us to work with local government and deliver an infrastructure that works for you. I'd love to hear any feedback you have on all of those things. But we have a range of mechanisms where we can share information and hear back what's working, what isn't working. And that's been particularly effective after the census, where we heard because the census was taken during a lockdown, where there were particular local authorities who felt that we had missed populations. Manchester is a particular area which relates to new builds, it relates to students, it relates to multiple households behind one single front door. And our work with them is enabling us to build a toolkit that can then be deployed across all areas, because we don't have the capacity to work with everybody in great detail. We want to exploit where there are resources and knowledge in areas who are willing to work with us, and then amplify the learning and democratize the way that we have problem solved in particular areas. And we'll continue to do that. Right, so back to the census. Products for different uses. No one is the same. Nobody understands or wants to understand data in the same way. Nobody uses the data in the same way. So we consider broadly these different personas, from a very technical user who wants to pull down the data via an API, for example, through to something that's much more qualitative, telling the story of the data. And as I mentioned, we've got this suite of interactive products. We've got the maps that show you, and I'll show you a few maps. You can build your own area profile, comparing variables with the England average or the UK average. That might be LSOA level or above. We've got a quiz, if you're keen to test your knowledge. We've got a range of bespoke analysis and individual bulletins. How your area has changed in the last 10 years is that comparison between the 2011 and the 2021 census. And the scrolly telling article is this new sort of robo-journalism that tells you a little bit more about the story as you move down the page. So that has been received very, very positively by a range of citizens and organisations, and will continue to invest in this way of communicating the data. So, you'll be aware that we have an increasingly rapidly ageing population. But it's happening faster at a greater level of density in some areas, and this map is designed to show you that. So this is 16 to 64, 65 to 84 in the middle. Sorry, 16 to 64 is the far left here. 65 to 84 is the middle, and 85 years of over there on the right-hand side. So you can see where the clusters are changing. And the ageing populations in some areas aren't being matched by the working age population on the left. And it won't be a surprise to you that coastal and rural areas tend to have the highest proportion of older people, but this masks an increasingly older population in urban areas where the proportion of older people out of the total may be smaller, but the number of older people is increasing. Here's another topic that we had in the census here around unpaid care. So by age standardising the population, we can compare the prevalence of unpaid care over time and across different geographical areas. It doesn't really matter that you can't read the small text here. What's interesting, I think, is the proportion of 9% in 2021 is a decrease from 11.4 in 2011. However, underneath that, the proportion of people providing 19 hours or less of unpaid care has fallen since 2011, but the proportion of people providing 20 or more hours has increased. Wales and the northeast of England were the areas in which the highest proportions of people provided 50 or more hours of unpaid care in 2021. So this is about tenure. So we can see from the Census 2021 data that people are less likely to own their own home than they were 10 years ago, but those who do are more likely to own it outright, and that's naturally likely as a result of an ageing population where more people are likely to have paid off their mortgage. We can see a decrease in the proportion of households that own their accommodation from 62.5% in 2021, from 64.3% in 2011. That's about 500,000 people. Ethnic diversity is another shift that we can see over the last 10 years. We've seen the continuation of the trend for predominantly urban areas, seeing ethnic groups becoming increasingly diverse. So you can see here the 10-year change with the darker shades being more significant in the change. So those are some, but not all, of the variables that you can dig into through the apps and through the tools that I talked about at the beginning. So where do we go from the census? Our consultation, I'm going to go to this next slide, which is at the heart of our consultation. As I said before, the census is a snapshot in time. It's a brilliant snapshot, but due to internal and international migration, very quickly the estimates become elderly and less useful at a local level. What our consultation proposed is that we obviate the need for a census by pooling together all of the administrative data held by government and public services, And alongside the consultation, we published a series of proofs of concept to illustrate the methods, the data, the complexity, the challenges of that work. The consultation closed just a couple of weeks ago, and we are currently in the process of analysing all of those. We had over 700 responses. We are analysing that. Our board will then receive a draft recommendation, and it will be for the UK government to decide what the next steps are from our programme. But essentially, you can see here that we have a system and a set of data models that will pull in a range of different data sets. When I say obviate the need for a census, and clearly that's a matter for government, but if we don't have another census, that doesn't mean we're not going to have surveys. We're still going to need surveys for a range of different reasons. That might be coverage adjustment, that might be for communities who are less likely to appear in administrative data, rough sleepers being an obvious one. But we use, at the moment, RAPID, which is a data set from DWP. We use GP register data. We use our international migration statistics. We use a variety of data. There are strengths and limitations in each one of those to produce admin-based population estimates. So you can see here, this is just about distribution and quality. So this top chart here, the cluster, shows you when we combine administrative data with the census. And you can see we've got one particular outlier. This is within quality parameters of 3.8%. So we would expect to see any population estimates being within 3.8% of the census estimate for it to be within reasonable quality at local authority level. If we take out the census, you can see a bit of drift here to the right on the green with the overcoverage. So we find when we pool administrative data together, we end up with more people, not less. It's much easier to manage a problem statistically with overcoverage than undercoverage, though. So we're relatively comfortable with that as a problem to solve compared to if you see the lighter blue current method, so this is what we call the cohort component method rolled forward, that you'll be familiar with, when we adjust for deaths, births, and international migration. So we're building confidence in the quality and the way in which this data can be used. Now this graph here is actually two lines. And the interesting thing about these lines, is that you can barely see the differentiation between the two. You can really see one line with a light blue confidence interval. Down here on the bottom x-axis is age. So if you're close enough to the screen, you can see that we've got more confidence on older age groups. When we pool our administrative data together, the confidence intervals widen at a younger age, around school age and younger working adults. So we've got more work to do to pool more data, to understand the limitations of administrative data, to reduce those confidence intervals right down. But as I said, because we're able to use pensions data from government, that tends to drive much higher confidence in the older age group coverage. So into something that's a little bit more novel. This is using mobile data. So we did a proof of concept, and this is published again, using mobile data to look at the movement of populations during the day. They do track very well with other mobility patterns that are held locally or that are obvious in other data sets. So we're going to continue to develop this particular model. We have a relationship with some mobile phone companies that enable us to track this with a view to a very short lag through the working day and obviously at weekends, but through the 24/7 patterns. And this is at LSOA level, admin-based population estimates again. Again, this shows a relatively tight set of estimates here. We're not really showing the same level of drift that we see with the census. And a lot of these outliers are driven by communal establishments. So our intensive work with universities or university towns and cities in particular are really critical to us tightening that bunch. And here is an example of multivariate data at local authority level. This is using Blackpool. You can see the difference, the net occupied address income, with the greater the income, the darker the shade. So you can see here where there are particular areas of deprivation, which of course you would get this from the census, but being able to have this on an annual basis at the same level of precision of the census is something that we're able to produce. And here we have a combination of ethnicity. On the left-hand side, you can see admin-based ethnic group estimates, broadly comparable with the 2021 census estimates. And on the right-hand side, we've got cross-tabulated information about ethnic group with data about housing information, such as housing type, which show us that Asian citizens are more likely to live in terraced accommodation than other ethnic groups. So we can track any differences in ethnicity and housing arrangements over time at a much more detailed level. So, looking to the future, as I said before, we're not going to get rid of surveys, regardless of what the government decide about a census as an institution and a way of collecting data every 10 years. Censuses don't give you the answer in this intercensal period. So we will need supplementary services, and we will need partners to work with, piloting, developing the right way to do surveys. We've learnt with the COVID infection survey going online, and we've learnt with the last census, that with the right communication, with the right engagement, with the right purpose and focus on why we're collecting the data and what's the value of that to a range of different people, that will influence better response rates and greater engagement. So we want to work with local partners to really amplify that message and to bring in new administrative data sets. Something that's very interesting to us at the moment is differential models by local area. So what I've tried to show you is what we can achieve at a national level using administrative data from national government sources. And there's plenty of that, and there is a lot of work still to do to improve the quality of that data, to improve the consistency and assuredness of the flow of that data. But there is still a lot of local data that you hold, which we think will be relative and important, both in the journey of improving the data that we can then play back to you in context, but also thinking about where there is excellent data sets that you collect that may be suitable for national coverage. So we want to continue to have that conversation. And we're having, as I said, this conversation with Manchester as an initial conversation to think about students, to think about new builds, to think about multiple households behind one front door. But if there are other particular community groups that you've got really good data on, where you think that you can add something and that you're interested in having a conversation with us where we can combine our data, as part of this new admin-based data model, please do reach out to us. So, as I said, partnership and case studies are really critical. I also wanted to mention ONS Local, which is funded by DLUC, and they are based in all the regions with analysts who are there to support your analyst colleagues to make best use of our data, that we have, as well as the emerging new research data. So please do use that community if you're not already plugged in. And do tell us if more events are useful, what sorts of deep dives around the differentiation between censuses or what we're seeing in the data at the moment is most useful to you. This is a very quick, high-level sort of flavour of what we've already collected and what we're doing now in the future, but there's a huge richness there to explore with you, particularly for those councils and areas who may not have well-equipped analytical departments. We know of some that have got very impressive, and they teach us a lot, these departments, but not all local authorities have that resource. So let us help where we can and where that's most helpful to you. And the basics of demography is the last point here about moving forward, examples of where we want to work. Quite often, we will hear statements about, we know that the dependency ratio is shifting, we know that the population is aging, but with the increased international migration in particular, we're seeing that shift so fast, and our ability to keep track of that and inform you of what the local demography, how it's changing and what that might mean for some of your local decisions is a really critical conversation for us, because we have to get that right. We have to earn that license to be able to move forward to the next phase of our population measurement. Unfortunately, I can't talk today about our latest population estimates. That's on Thursday, shout out. So for the 23rd, we'll be publishing our latest population estimates and our latest migration estimates as well. But again, there's follow-up conversations where that's most helpful. Very happy to take questions. Thanks very much for your time.
Thank you very much, Emma. We've got less than 10 minutes for questions. I'm sure people will be going away and looking at build your own area profile, and that you won't be able to answer questions about people's specific localities, but those general questions across the country and about how to interact with the ONS. So any questions, please? If I take Kate first. Mike's just coming your way, Kate, and then a couple in the front.
Hello, Kate Canally from Cornwall. Thank you very much, Emma. Loved the quiz, by the way, on the census. But my question was about how we can work together with the ONS in terms of data and artificial intelligence. So one of the key things that's on our mind at the moment around AI is about how do we make sure that we've got data sets out there that are able to be capable of AI being applied to them and coming up with something that doesn't kind of take us off into weird and wonderful directions. So our thinking within the council is around really trying to get underneath our data quality, and thinking about how we're putting it there. What role for the ONS, and how can we work together on that?
Is that okay if you'd like to take that one, and then
Sure.
I'll come to
That's a great
couple
question.
of gentlemen at the front.
Thanks very much. So AI is something that we're thinking a lot about, and our population model, the dynamic population model, is a machine learning model. So we're already building in a degree of artificial intelligence within the estimate. So we're trying to keep pace, and want to be as transparent about that as possible, about where we are imputing and where we are using technology to adapt to some of the limitations of administrative data. I think there's a real risk in citizens potentially accessing data and coming to their own. I would say that that's happening already. I mean, we've seen that around some of the debate around vaccines, with the misrepresentation of some of our analysis happening. So I don't think the answer is just AI in terms of being able to deal with some of that regulation and calling out misinformation. And I think ONS has a role to play in our presence being more strongly felt in countering some of the misrepresentation of data. In terms of what role we can play together, I think that's really interesting, and I'd love to talk more with you about that, about what the options might be. I think what we'd love is that when people continue to search for information that they that they trust, that there's an ONS badge attached to it. But the democratization of data and AI means that there's an increasing number of ways in which people can access data and come up with their own trusted figure. So I think a lot of that is on ONS to strengthen, but in terms of how that's communicated, how that's amplified to citizens, I think local partnerships have a really big place to play. Yeah, big place to play. So I think there's definitely more to do here, but there's some initial thoughts. I hope that's helpful.
Thank you. Yes, please. If we take those two.
Okay. Thank you. I'm John Bloxham. I'm an elected member from Gloucestershire. I wanted to ask if there's any discussion going on about how you could use any of this data to inform the process around drawing up electoral boundaries, because one of the issues that's clear from the recent changes is that disproportionately more transient populations and poorer populations are more likely not to be registered, and when the electoral commissions just use registration as their benchmark, they're missing a chunk of the population. So there's estimates that there are significant undercounting going on in various parts of the country, which skews the way in which boundaries are drawn up. So is there any scope for supplementing registration data with this other data to provide better estimates?
Thank you. David, did you have a question?
I do. Emma, you know how you always fear a left-of-field question coming? Well, it's coming.
I love them. I love them.
So, David Fothergill, Somerset. Everybody in this room could go online, look at your data, and find out their ancestors going back to 1801, because that information's all there. How can you reassure us that that information will still be there in 220 years' time for our future generations?
Yeah, okay.
So the electoral boundaries. Oh, do you want me to?
Sorry, no,
sorry.
yeah, carry on. Sorry, I was just pointing out the next one.
That's not a decision for ONS. I think if the Electoral Commission contacted us and asked us to look at that, then we would respond. But I think it's not a matter for ONS. I'm afraid. I can see why somebody might ask the question, but I think it's for the Electoral Commission. Future generations of census. So it's a question that's come up a lot through the consultation, and I'm assuming your question comes from if the 2021 was the last census, what would we do? Well, the first thing is to say that we won't be releasing another census until 2051. Because of the impact from the war on taking the census 100 years ago, and we want to make sure that doesn't happen again. We want to make sure that we have a statistical population register that is held for evermore and doesn't rely on the stability of any domestic scenario. So. It's a must-do criteria for us. We have we've published a sort of successive acceptance criteria, and that's very much part of that. What that actually looks like, whether it comes from our base data or whether it's adjusted, is probably going to be adjusted, what we call our statistical population data set. So we have identified, rather than a demographic index, which is much more of a longitudinal database, the statistical population data set is one that's been adjusted where we're really confident that there's very limited under or over coverage. What I think is really interesting is what we do with that data set to allow citizens to potentially put their own records. So there was somebody was talking recently about the sort of human experience of seeing the handwriting of their ancestors and some of the comments that were put in. But if you think about what people are putting on social media at the moment, if you think what's out there, the richness of the human experience that's on the internet, how can we link some of that to the record so that your ancestors in 100 years' time can come back and look and see what you did on your 21st birthday? I think there's something quite interesting about how we use the opportunity of administrative data to even broaden out, because we're not limited by a survey. Right? We're limited by our own imagination.
Thank you.
Essentially.
The lady right at the back there. Thank you.
Thank you. Denise Turner-Stewart from Surrey County Council. Whilst you're refining your modelling techniques, do you overlay with consumption levels of energy, food, water or sewage discharge, just in terms of looking at when you have sudden changes or unexpected adjustments in population change, how that can be sort of validated by similar changes in human behaviour? Thank you.
Thanks, that's a great question. So some of that data has emerged through the 14 pilot local authorities that we've been looking at, so where we've attempted to replicate population estimates through administrative data and tested them with the 14 local authorities. Some of their contribution has been in, well, this is what we see through other data, some of which is similar to what you've just described. At the moment, we don't collate that, but we will. So it's a direction of travel. I think we're seeing the value of it in those local conversations. So we have to think about how and when they can be built into the model in the longer term. So I recognise the value.
Thank you. Emma, I'm aware that there's a couple more hands up, but that we're getting to the refreshment break, which not only is the refreshments, but it's a really important part of the conference for people to have those conversations informally. So I don't want to get into the way of that. But are you here for a little while to have some conversations? So if you didn't manage to ask your question, apologies for that. But Emma will be here for a while longer to have those informal conversations with you. So thank you very much, colleagues, for your attention. Please enjoy your networking opportunity.
substitute for Barry Lewis, the Vice Chair of the CCN, who was due to chair this session, but has conveniently gone down with COVID. So we felt it probably better that he didn't come here and infect everybody. So apologies for that. This session we're going to look at, though, the outlook for public finances. So I think that's going to be pretty upbeat. It is, of course, a big week for politics generally. I've already sent my personal apologies to Jeremy Hunt for overshadowing his autumn statement by having the CCN conference the 2 days before, but I think he'll get over that. The economy and what it means for local government financing generally is, of course, the topic for this conference. I mean, we've seen a space of 114 notices being served. I think people are sort of, there are differing views as to whether some of those councils, in some respects, brought that upon themselves. But there's no doubt that we are now starting to see really well-run councils starting to run out of road. Some may say that there's a little bit of a crying of wolf from some councils, but at the end of the day, we're getting more and more demands and less money to deliver those. And as we know, this year, particularly massive overspend on all councils, particularly around children's placements and home-to-school transport. So I think it's time that we heard an expert view on actually what we can look forward to. And that expert is, of course, Paul Johnson. Paul has headed up the IFS now for some 12 years, previously at the Department of Education, and indeed, chief economist there, and was the Director of Public Spending at the Treasury. I mean, Paul is well known to all of us. We see you regularly on the television, and it's great to have you here with us and to hear your independent view on kind of where the economy is going and whatever else you want to talk about. So, Paul, thank you very much.
Well, thanks ever so much for that, and yes, lots of good news to come. Sadly, not that much. So I'm going to start just by saying a little bit about where the economy is and then talk about some of the issues in the public finances, particularly as we come up to the autumn statement, presumably the penultimate fiscal event before an election next year. So let's just start by reminding ourselves where we are in terms of economic growth. This is national income per head. It looks better if you just look at national income, but you can easily grow national income just by growing the population. What matters is how much we've got per person. Key thing there you can see at the end is that it is the same today as it was in 2019, so a parliament essentially with no growth. Now, national income is a bit above, but the population has grown. And the remarkable thing is it's only about 5 or 6% higher today than it was in 2008. And as you can see in the period before that, it was growing at sort of 2% a year. Over the last 15 years, it's grown at less than 0.5% a year. So that's the backdrop. It is worth saying that this is not massively unusual in terms of the experience of many other European countries in particular. It's easy to get quite down about where we are. We're doing a bit worse than a lot of other countries, but the whole sort of particularly Western European world has slowed down a lot since the financial crisis. And the reason this matters for households and the reason that the cost of living crisis has hit so hard is this, which is that household disposable income barely grew over that period either. And so you get the cost of living crisis. Normally recessions come after a period of growth. This crisis came after a period without growth. And just to give you a sense of scale, had the trend over the previous 60 years continued, that's where we would have been going. So the scale of loss to household income relative to what we might reasonably have expected is just enormous. Now, you might think that that trend couldn't have gone on forever, but it is an indication of the extent to which households are feeling so much worse off than they might reasonably have expected. Now, I'm not going to talk now about things like housing costs and the collapse in home ownership and so on, but that has been accompanied by this. And these underlying economic trends, I think, explain a lot of the political turmoil we've seen over the last decade. A long period without income growth, falling home ownership, the young falling behind the old, and so on, has an effect on people's political views. So that was history. What about the future, which is what everyone always asks about? Well, if you saw the Office of National Statistics reassessing history a month or two ago, you'll know that it's quite hard to know where we've been. It's even harder to know where we're going to. So what's likely to happen to growth? Well, that single line is the average of recent independent forecasts. But this, the Bank of England, as you see, is rather less optimistic than most others. So if the Bank of England is right, we're only going to grow about 0.5% this year and not at all next year. Really very feeble indeed. Clearly, one of the things that's really going to matter on Wednesday is what the Office of Budget Responsibility says. Now, the OBR back in March was actually quite positive. I mean, that's 2% a year growth after next year, more than the average, way more than the Bank of England, and actually it was way more than the Bank of England was back in March. The bank has been consistently pessimistic. And indeed, despite the claims of politicians, the Office of Budget Responsibility has actually seen the future through rose-tinted spectacles over the last many years. It does its own assessment of its own forecasts, and its forecasts are, on average, overly optimistic. And I think it's going to bring that growth forecast down quite a lot towards where the Bank of England is. So, first thing to look out for on Wednesday is, what are the OBR figures looking like? What do they look like next year? Are they as bad as the bank, which is assuming no growth at all next year? And where do they go after that? I'm not going to talk about inflation in this presentation, but the other thing to look out for is where the OBR is on inflation, because that is actually going to matter a lot for the public finances. A bit of inflation, rather good for fiscal drag. And one of the reasons that, despite the fact they're almost certainly going to bring their growth forecast down, their public finance forecast might not look worse, is they're almost certainly going to put their inflation forecast up. Back in March, they were assuming literally zero inflation by the end of next year. I don't think anyone expects that anymore. So that's going to underlie the decisions that Jeremy Hunt has on Wednesday. What about borrowing? I'm sure Mr. Hunt's going to make a lot of this. It looks like we're going to be borrowing significantly less over this financial year than expected back in March. So the dotted green line is the OBR forecast from March, and the solid bars are what's actually happened. So we're about 20 billion below March forecasts so far. That's probably not going to translate into, that's half the year, it's probably not going to translate into a 40 billion fall in borrowing relative to forecast, but it almost certainly be a 20 to 30 billion fall in borrowing relative to forecast. Now, really important to be clear about one thing here, which is that may be lower than the March 2023 forecast. It's an enormous amount more than the March 2022 forecast for this year. The economy is doing a lot worse than we expected 18 months ago. And again, chancellors are very good at making comparisons with whichever forecast they want to make comparisons with. So, but the key point is that borrowing does look like it will be reasonably substantially lower this year than was forecast back in March. What's more, it's going to go down to quite low levels. So the OBR in March thought it was going to go down to under 2% of national income by the end of the forecast period. Our forecasts on more recent data, we think broadly the same thing. And that's quite low by historic standards. The target in terms of borrowing is that borrowing should be below 3% of national income. And on these forecasts, we're comfortably there. Though again, remember, the yellow line there is the forecast as of March 2022. So it's coming down, it's looking better, but it's still looking a lot worse than it was 18 months ago. So in one sense, borrowing doesn't look like too much of a problem. The problem is falls on the debt side, which I will come on to in a minute. So the borrowing, of course, is the difference between revenues and spending. Well, what's been happening to spending? Well, it's been going up, and it's been going up quite a lot, and I'll say a little bit more about this in a minute. But this is the sort of thing that makes, I think, natural conservatives rather uncomfortable. Spending is looking like it's going to settle at, say, 44% of national income. Before COVID, it was at 40% of national income. That's a 4% of national income increase in spending. That's about £100 billion a year of more spending than we were having as a fraction of national income pre-COVID. Now, I'm going to come on to explain that, partly to do with demographic change, partly to do with poor growth, partly to do with very, very high debt interest payments. So the yellow line here is spending excluding debt interest payments. And you can see that the gap between the yellow line and the red line is bigger than it has been at any period over that last 30 years or so, and indeed bigger than it's been at any time for something like 70 years. So debt interest spending is rising inexorably, and that is creating a big problem for the government. The green line here is revenues. That's not just tax, it's other revenues as well. Something remarkable happens there. You see in about 2026, revenues are going to be higher than non-debt interest spending, first time since the turn of the century, and yet we're still going to have quite a lot of borrowing. And again, just to reiterate the point, one of the biggest problems that the government is facing is just sheer quantity of debt interest, and we're going to bring in more in revenue than we've got to spend on stuff, on everything, because we're spending $100 billion a year or so on debt interest. And that spending has gone up really very fast over the last very small number of years as interest rates and inflation have gone up. So it looks like there's quite a lot of money around. And indeed, over this Parliament, and this is something that may well come as a surprise to most people working in the public services, spending has risen really quite fast. So if you look over the 40-year average, spending on public services has gone up by just under 2% a year, but over this Parliament it's gone up by 3% a year. So this has been a genuine and big change from that decade of austerity that we had up to 2019. Spending on public services has risen faster than average. And this is not a COVID-related point. This is entirely separate from COVID. There are lots of mysteries here. I mean, spending on the NHS has gone up reasonably fast over this period. We do genuinely have a lot more doctors and nurses. The NHS is doing precisely no more than it was doing in 2019, despite all of that extra resource. And of course, that high level of spending increase over this period has nowhere near undone the decade of cuts that went before, and it's probably one of the reasons why it doesn't feel like those increases. What you see penciled in to the budget assessment back in March was a 1% a year growth after 2025. My guess is that that will be kept and pushed forward another year. So 1% a year growth over the next 5 years. You can see that's pretty low compared with the 40-year average, very low compared with this Parliament. And therein, I think, lies the challenge for all of you and indeed the rest of public services. So if what happens is what's put in the public finance numbers, which is that 1.1% a year growth, well, we know that the NHS will get much more than that. It always does. The biggest fiscal announcement of the last year, and arguably the biggest fiscal announcement of my lifetime, actually, outside of crises, was the NHS workforce plan in June. That workforce plan by itself will raise spending by 2% of national income, about £50 billion over the next decade or so, if it happens. That's the scale of what was announced back in June. I mean, absolutely colossal. That workforce plan by itself will be about equal to the entire schools budget, for example. So we can expect NHS England to get some more money. Let's assume schools don't get anything. Defence, just to keep it at 2% of national income, which is our minimum international agreement, though there's quite a lot of pressure to do that. Let's assume that stays. And overseas aid stays at 0.5% of national income. Big increase in childcare spending announced in the March budget. What does that leave for everything else? It leaves a cut of 1.5% a year. And that is the kind of challenge that is in those public finance numbers. Now, that is not a prediction from me about what will happen. I don't think that will happen. But that is essentially how the Chancellor makes his numbers add up, by, in my view, pretending that spending will rise only by 1% a year on average over the next 5 years. And that's how he will get some so-called headroom in the autumn statement, by pushing that out for one more year of very tight spending plans. So that's what underlies the public finance numbers. It's also worth saying, so that's just the day-to-day spending. On investment, it's moved around rather a lot. Current government policy is to hold investment spending flat in cash terms from what is currently a relatively high level, but that again means obviously significant real terms cuts in public sector investment. And you can see, it's genuinely, this government has increased that relative to its long-term average. It's still well below the international average, but it has increased it. Labour is promising an extra 20 billion for green investments. As you can see, even that isn't enough to keep investment spending at its current level overall. So those are the numbers that are, this is just arithmetic. I'm not sort of, as it were, forecasting the future. I'm just telling you what the numbers are currently saying. Now, why is there so much pressure, given everything I've just said, for tax cuts? And I think this is the reason that actually over this Parliament, taxes have risen by more than they've risen over any Parliament since certainly since 1950, when we've got a consistent kind of data. Now, why have taxes risen so much over this period? Well, it's that combination of poor growth, the cost of COVID, high debt interest payments, and we're finally really reaping the effects of demographic change in terms of what we're spending on health and pensions. My guess is that, so whatever Jeremy Hunt does on Wednesday, whatever he managed to do in March, that is going to remain the case. This will be the biggest tax-raising Parliament essentially in history. Now, again, that does make his party pretty uncomfortable for fairly obvious reasons. My guess, so that will take tax revenues to their highest level essentially ever, after a long period of going up and down, but essentially stability. My guess is that taxes will remain at their highest level ever for the rest of my lifetime. I don't think we're going to get taxes back down to where they have been for the last half century because of those pressures on public spending. We've had a decade of austerity, we've cut defence as far as we can cut it, we've got more money going on health and pensions. I don't see how we, unless there is some change in the political settlement about how much we want a free health service, about whether we're going to have a basic state pension, about whether we're going to have free schooling, about whether we're going to have somewhere close to adequate safety net. If we're going to keep all of those things, I don't see how we get taxes and spending down again. One of the how have taxes risen? Well, the main thing is the holding of the income tax threshold and allowances constant in cash terms, whilst inflation and earnings have been very high. So this is going to result in, for example, the highest fraction of adults paying income tax than we've had at any point, about 2/3. It's quite remarkable, about a third of adults don't pay any income tax. They may be students, they may be married to someone who's earning rather more, they may just have benefits or the state pension. But you can see that's gone up from about 58% to 66% over this period. So an increase in the number of income taxpayers, and in particular, very big increase in the number of higher rate income taxpayers. So given that that higher rate threshold and the personal allowance are frozen, we've gone from about 4% of adults to about 16% of adults over that 30-year or 40-year period. Now, roughly a doubling, an 80% increase between 2020 and 2028. Again, one of those things that makes a lot of people pretty uncomfortable given the scale of tax rise that implies. The freezing of allowances and thresholds for 6 years is about a £50 billion tax rise. If you think of that as a single tax rise, it is arguably the biggest one that we've ever had. Remember, when Rishi Sunak first introduced this, it was for 2 years, when he didn't realise that inflation was going to be so high, and that was only going to raise about 8 billion. So this has turned out to be 6 times bigger tax rise than it was originally intended to be, but in a way that's relatively straightforward to achieve politically. And the problem, in a sense, is those great big tax rises, because we've got weak growth, are only just enough to stabilise debt as a fraction of national income. Now, when people talk about does the Chancellor have headroom, the question is, does he have headroom against this particular target that he has, which is that debt be falling in the 5th year of the forecast? It's a completely mad target. I mean, we do want debt to be falling in the medium run, but whether it's falling between the 4th and 5th year of a particular forecast really doesn't make very much difference. As you can see there, it's essentially flat. It was £6 billion worth of so-called headroom in March. Maybe they'll get up to 20 billion. 20 billion pounds 5 years out, given all the assumptions that are required, is essentially the same as zero, not least because it assumes, what I just told you about those very, very tight spending plans, it assumes things that won't happen, like fuel duties will go up year on year on year. And of course, it depends on exactly what the forecasts are for inflation and growth and all those sorts of things. So Chancellor stands up on Wednesday and says that we've got 20 billion of headroom. 20 billion in these circumstances is a minuscule quantity of money. And just to sort of make the point again, debt interest spending is a big part of the problem here. So back in March 2022, the expectation we'd be spending less than £50 billion on debt interest in 2026. That went up to 90 billion in March. It may have come down a bit, actually. We made these calculations a couple of weeks ago, but market expectations have come down since then. But it looks like we'll be spending more than 100 billion a year by 2026. That's more than we spend on any public service bar the NHS. That's the scale of what we're looking to be spending on debt interest because of the obviously very high levels of debt that we've got, but also the high levels of interest rates and inflation, creating this problem, which is that just to keep debt stable, we need a primary surplus. In other words, what I showed you in one of those earlier charts, we need to be taking more out of the economy than we're putting back in just to keep debt stable. And that, again, is not a problem we've had for a very long time because of those extremely low interest payments that we've had for a long period of time. And just to illustrate the kind of consequences of these increases in taxes, this is the March forecast from the OBR about what might happen to earnings over the next 8 years. So, I mean, that looks quite nice, but it's terrible. I mean, that's 5% growth in earnings over an 8-year period, where we'd normally expect at least double that over an 8-year period, arguably 3 times that. But that was their view about what might happen before tax. We calculated what's the impact of the tax rises on that. Well, it's to just turn that into a 2% growth over an 8-year period. I mean, that's the scale of the additional tax that people will be getting. So even if pay does go up by a paltry 5% over that period, take-home pay will only go up by 2%. That's the consequence of the freezing of those tax thresholds and allowances. So just to sort of wrap some of that up, there is some good news. Not a lot, but there is some. So relative to the forecast back in March, growth this year looks like it's done slightly better. Both the bank and the OBR were essentially expecting 0 growth this year, and we've had a little bit of growth. I haven't talked about inflation. Inflation has halved, nothing to do with the government. I mean, despite the fact that Mr. Sunak says that's one of his targets was to halve inflation. Combination of what's gone on internationally and the Bank of England, which has put interest rates up 14 times in a row. The only thing the government has contributed is not to do anything really stupid, but that's that's a good start. But that's essentially all they've contributed to halving inflation. And borrowing this year is likely to be in the order of 30 billion less than was forecast back in March. So those are the sorts of things that we can expect to hear front and centre in Wednesday's statement. These are the sorts of things that you might hear rather less about. The Bank of England forecasts zero growth next year. It'll be very interesting to see where the OBR comes out. Traditionally, they have been more cheerful than the Bank of England. We'll see whether they remain more cheerful. But my guess is they're going to be forecasting very little growth next year. The OBR living standards have grown very little, barely grown in a decade. Back in March, the OBR actually sort of headlined almost on we're in the middle of 2 years of the worst growth in household income in the 70 or so year history of that series. We'll see whether they get a little more optimistic about that or not. Taxes are rising to record levels by UK standards. Taxes are heading to about 37% of national income, having been in the 33-34% range for the last 50 years. And as I say, my guess is that they will stay at that higher level for the rest of my lifetime unless something quite remarkable happens. That's a big change for us. Important to be clear, taxes will still be lower than they are in most of Western Europe. Despite all that, there's little money for public services. Now, as I say, has been a genuinely quite generous Parliament for public services in terms of the scale of growth in public service spending over this Parliament. But if you take seriously what the Chancellor has put in his statements up till now, the next Parliament will be really tough. And of course, this creates the most extraordinary difficulty, not just for this government, but for the opposition. Even putting all of that together, and largely because of these increases in debt interest payments, national debt is basically stable and not falling. And one of the things that Rachel Reeves and Jeremy Hunt appear to agree on is that they both have a target to get debt falling over the period of a Parliament. So if you're going to get debt falling over the period of the next Parliament, you're starting with taxes at their highest level ever. Do you raise those? You've got spending commitments which look really tight. Can you tighten those any further? Or can you, as both Chancellor and Shadow Chancellor correctly want, but can they achieve it? Can you get really significant additional growth to dig you out of that hole? So I will leave you with that conundrum, and I'm now very happy to take questions.
Well, there we are. What can possibly go wrong? Right. Izzy, I can see your hand up. And Roger. We'll take 2 questions at a time, if that's okay. We've got about a quarter of an hour, so see how many we can get through.
Paul, thank you very much. Very interesting and entertaining as always. Can I ask you to comment? The one thing that was very quiet and silent during COVID was the write-off of the NHS debt, which presumably has produced a good revenue income for them. I'd like to know where that went, and also, where was it centralised? Was the debt centralised? Do you have a comment on that?
Paul, we take 2 questions, if that's it. Roger, do you want to go next?
Thank you. Slightly different question, which is very interesting, the point at the start about the different views on growth, and particularly the bank's view on that. And your point that the OBR is actually not as pessimistic not as pessimistic as sometimes thought. How are we to interpret that difference between them? And is the bank taking a view on the longer term prospect, or is that just a sort of tactical view over the next year or two? Because I know people like, indeed, IFS, Resolution Foundation and others have been making the case that the prospects for growth are pretty slow. So just interested in where the Bank of England actually is positioning itself on that.
So on the first of those questions, I don't know the answer, I'm afraid, to issues around NHS debt write-off. I mean, one thing I will say is, quite surprisingly, in a sense, NHS spending has grown, but it's grown less quickly than was intended pre-COVID. So one of the reasons that I think the NHS feels that it's been underfunded is because if you look at the real increases that were planned in March 2020, they've actually got less than that, despite the additional pressures. The reason that I think the rest of us can feel a bit worried about it is genuinely there are something like, I can't remember exact numbers, 15% more hospital consultants, 10% more nurses, 20% more real funding, and literally no more activity at all in the hospital sector. And that is one of the reasons I thought what Amanda Pritchard said last week, that she didn't accept there was a productivity issue, I thought was slightly surprising, because there does appear to be a productivity issue. I mean, there are lots of reasons for that. It might be to do with not being able to get people out of social care. It might be because of disengagement of the workforce. It may well be to do with lack of investment in equipment and so on over the last decade and more, as capital money has moved into current. But there is definitely an issue there. In terms of growth, it is slightly odd, isn't it, that we have two official forecasters, one responsible for monetary policy and one which informs fiscal policy, who can come up with really quite different forecasts for the economy, and they do it in very different ways. The Bank of England is very model-based, and they've got Ben Bernanke, the Nobel Prize winner and former chair of the Fed, coming in to sort of look at their models, because they didn't predict inflation at all well 2 years ago. The OBR is much more judgment-based, so they have models, but they do layer a lot of expert judgment on top of their models, more, I think, than the bank does. And my guess is, I say, the OBR will come down towards the bank this time round. And partly, the bank is constrained in a sense. It always has inflation going towards 2%, which has an effect on its forecast. The OBR feels able to say that inflation won't go towards 2%. As I said, in March, thought it's going to go literally to zero, and if anything negative, really quite soon. So I think the two will converge a bit this time round. But it is, as I say, very striking that the OBR, on average, is overly, or has been overly optimistic. Not what you hear from certain Brexit-supporting politicians.
And if you ask a question, if you could just say who you are and where you're from. I think the gentleman at the back there. And then...
Thanks, Tim. Yes, Richard Bell, Cabinet Member for Finance, Durham County Council. You've half answered my question, which was about NHS productivity. It will have come as a surprise to many of us to learn that government spending has increased over the last 10 years, but the beneficiaries of that are principally the NHS. And yet you say we've got more doctors and nurses, yet the output is flat from 2019. Now, obviously, we've had COVID in the middle of that, but it would seem, put bluntly, that unless somebody fixes the NHS or the NHS productivity problem, we're looking for another decade of the same, because if there is any spare cash, it will inexorably go to the NHS, which is pretty bleak for those people sitting here today. Thanks.
I think there was a gentleman's hand at the back there somewhere. Sorry.
Thank you. Sort of related to that, you talk about investment and how we spend more on investment. That can have an impact further down the line. But do we have any breakdown, any independent analysis of figures where we're investing in prevention rather than buying pieces of kit? Things like in Cornwall Council, they've cut the amount of money they spend on cleaning out the roadside drains, and lo and behold, 2-3 years later, they're spending an awful lot more money on fixing potholes. The government says, here's billions of pounds more to spend on fixing potholes, but we're not going to give you any more money to unblock the drains. And the same in education. We cut money for classroom assistants, and now we're spending tens of thousands of pounds sending children to exclusion units. And the biggest one of all, prevention on climate change, insulation and all that sort of thing, would save huge amounts elsewhere. Is there any independent analysis of how much of government spending is going on prevention rather than crisis and cure? Thank you.
Thank you. And of course, that's related to how much we spend on health. I mean, one part of the reason, over a longer period, not over the last 4 years, but over a longer period, part of the reason that we're spending more on health is, of course, because the population is getting bigger and older, and there are more people with multiple chronic health problems. So actually, if you could reduce through prevention, reduce that, you might have some positive effect. Though the problem with prevention in health is that if you prevent someone getting ill today or make them better today, they do still get ill later on. You know, we all die. And it's right, you know, I think we should be concerned if you're in a bit of the public sector that isn't the health service about the amount that it takes up. So of day-to-day public service spending, it was about 25% of the total back in 2000. It's hitting about 40% of the total in the middle of this decade. I mean, that's an extraordinary change. Perhaps we shouldn't be so surprised. I mean, in a sense, there's not much point getting richer if you're dead. So it's not surprising we sort of, you know, spend more on keeping ourselves alive. And we're not at all unusual by international standards. We spend about the European and OECD average on health. But actually, a lot of our outcomes are less good. So there is a problem about the way that we deliver healthcare. So you know, you're absolutely right. I mean, you will see this in your own, in a different sense, in your own world. You're spending a bigger and bigger fraction of the total on adult and children's social care, aren't you? And I think, you know, the national picture is spending a bigger and bigger fraction of the total on health. So I've already forgotten what the other question was. What was it about?
Well, I think it's kind of what you spend your money on, and actually, should you focus more?
Sorry, on prevention. Yes,
early
prevention. Yes, I mentioned that at the beginning of my answer. It's age. I mean, there are lots of ways. There isn't an answer to how much we spend on prevention, because obviously you can define prevention spending in all sorts of different ways. We know that we've cut some of it quite significantly. So whilst there have been actually big increases in spending on childcare, there have been cuts in spending on Sure Start and indeed on those elements of childcare that are available for the poorest families. So this has become more of a sort of a service, a childcare service for people in work, and much less of a sort of preventative thing for poorer children. There are clearly, I mean, post-COVID, we know the problems in the school system. Kids not turning up, a big, an increase in the gap between those from poorer and better off backgrounds, and that will create problems down the line. And we're not spending money, or not much money, on undoing some of those issues. So I think the answer is I don't think there is a single answer to how much are we spending on prevention, but I fear that we have got ourselves. As we've seen in going back to the NHS again, what happened in the NHS through the 2010s was that money that should have gone on equipment and buildings went on preventing sort of disaster in the short run. And I think that's happened across the public sector. When there's a tightness of money, you deal with the urgent, not the important. And I think we have neglected the important for some considerable period of time, which is creating more problems with the urgent today.
And I think we have to be careful with the NHS not to see a double whammy, actually. So not only do they get more funding, as we know, than local government does, but where we're looking at integrating health and social care, that we don't see some sort of cost shunting into the NHS and the recent sort of directive from NHS England, around cost savings is significant, and there are very few ICSs around the country at the moment that are going to produce a balanced budget. So I think we need from a local government perspective, we need to keep an eye on that to make sure that we don't end up picking up the cost. Are there any other questions? Yes, here, and then the lady in the front here, thank you.
David Hitchener from Herefordshire. Last year when we were here, we were told there's a real concern about deflation, something which we'd never experienced before, but it was quite a shock to me to see that kind of thing forecast. You're not forecasting that now, Paul. I'd be interested to know your observations on that. The other element is inflation. So yes, it's halved, but if you look at food inflation, that's up 10% still. So for the real inflation, what really hits people in the pockets is still very, very high. And I'd appreciate your observations on what you think is going to happen to that inflation figure rather than oil prices. Thank you.
Do you want to take that question first?
Yeah, so my guess is what you heard earlier about deflation was based on those OBR numbers that I was talking about, and they were talking about prices not rising at all or even going down a bit. We had worries about deflation, I can't remember, 6 or 7 years ago when we had literally zero inflation and it looked like prices might be going down. We're not in that world going forward. I mean, look at what's happening to earnings. Earnings are rising at whatever it is, 7% a year at the moment. That's one of the reasons why the Bank of England is worried that even with interest rates at their current level, it's still going to take maybe 2 years before we get inflation down to their 2% target. So I don't think we're in a world of deflation. I mean, what we are in a world of, which is I think a good thing, finally, is real positive interest rates. So essentially since 2008, interest rates after you take account of inflation have been negative. That's one of the things that's pushed asset prices up, it's pushed the price of housing up, it's created this issue between the older groups and younger groups. And a world in which, say, we've got 2% inflation and 3% interest rates is a much better world than one we've got 2% inflation and 0% interest rates, which is the one that we've been in over a long period of time.
And the last quick question, thank you.
Hello, Kate from Cornwall. Thank you very much. I guess I'm interested in looking at your predictions that growth is going to be the only real sustainable way for the UK to be able to fund the public services that it wants. Thinking about where local government fits, what do you think we should be asking for as a sector in terms of working with the UK government to support growth through things like fiscal devolution? If you were our chief economist, what would you be advising us to be asking for from this next government?
Planning reform. Easy for me to say, but it's clearly the difficulty of building is a big problem for growth. I'm absolutely convinced by the evidence on that. I know it's politically difficult, and I know it's a complex area. But more houses where there are jobs is absolutely crucial. Better infrastructure in terms of particularly public transport outside of London to the big cities like Leeds and Manchester and Birmingham and so on is absolutely crucial to growth. In terms of devolution, I'm still fairly sure of this, though I can't prove it. I do think regional devolution of economic power over a long period of time can be good for growth. That's what the sort of international evidence suggests. So this isn't about devolving powers probably to the level that you're mostly working at county council level. This is devolving powers perhaps to the 9 English regions in a way that many other countries, whether it be Germany or France or the US, or most countries have much more economic policy making and public service delivery devolved to those kind of levels. And there's at least some reasonable evidence that that is good for growth in the long run. I mean, there's lots of things that matter for growth, and governments just don't do them. I mean, there's tax reform, there's planning reform, there's infrastructure investment, there's further education, vocational education and apprenticeships. There's building roads, rail, and those sorts of things. We know there's allowing houses to be built. We know all of those things are good for growth, and actually, you have some role in all of those things, and in the long run, that's the only way I think we're going to get there. That, and in a sense, obviously, the closest trading relationship we can have with the EU. And the last thing I'd say, what has been one of the biggest issues that has stopped growth over the last 7 years, political instability. I mean, political stability is not a sufficient thing for growth, but it is an absolutely necessary one. And when you've got the kind of complete chaos we've had until recently, that is not good for economic growth.
Well, our next session is going to be all about local economic growth. So, Paul, thank you very much. I mean, as expected, huge insights into the whole wider economy, and we'll watch with fascination your analysis of the Chancellor's statement on Wednesday afternoon. So, thank you very much.
Thank you. Good afternoon, everybody. Firstly, before we start, just to let you know that we have swapped sessions. So we are going to be talking about the LEP transition now, and the other session will follow. So it's a delight to be here with panel members this afternoon. My name's Louise Sunderland, and I'm a partner at EY. I lead our local and devolved government practice. And this afternoon, I'm joined by 3 panel members who are going to tell us how to drive economic growth. But we're going to talk about that through the lens of the LEP transition. So I'm joined by Andrew Smith, who is the chair at Buckinghamshire LEP, and also is on the board of Pinewood Studios, having had an extensive career in film and industry and awarded an OBE for services to film and industry in 2022. I'm also joined by Richard Roberts, who is the leader of Hertfordshire County Council and also the economic growth spokesperson for CCN. And also Debbie Barnes, who is the Chief Executive of Lincolnshire County Council. Has been the Chief Executive since 2020 and has taken the Council through an extensive improvement journey and has a background in social care and was also awarded an OBE for her services in 2018. So I feel very privileged with our panel members this afternoon. So firstly, I'd just like to give a brief overview of the work that we did with CCN and looking at what LEP transition might mean. And it's probably fair to say that the discussion on local enterprise partnerships and what was going to happen to them has been around for some time. And it has been under scrutiny for a long period, and obviously then there was a big consultation on the way forward, which I no doubt the majority of you in the room responded to. Having done that work, there were some key things that came through the engagement that were really important to look at actually what this means and the potential opportunities and challenges that this might bring. Because as we know, doing this type of transition is not often easy. What we found through the work that we undertook was, from a geographic coverage perspective, the distribution of coverage that CCN members hold covers a good area economically, which underscores your opportunity to really look at helping shape regional development policies and drive growth. Further economic coverage, from a perspective of looking at CCN members across LEP regions versus those of cities, there is a real need for CCN members to be looking at how you can take growth forward. And this opportunity being presented is part of that conversation. There is good sector coverage across CCN members, especially in future growth areas like professional, scientific and technology. And it will be important to understand your places and how you drive forward those key sectors to increase productivity and drive your local economies. We heard through the extensive engagement that there are some key principles for this success, and I'd like to bring this out as part of the conversation this afternoon. That there is a need for more of a strategic intent when it comes to economic development and growth. There is a need for understanding at a spatial level of your places and understanding your communities that you're serving as part of that role. That there is some more relevant elements that sometimes are more difficult around actually roles and structures and functions. The not so exciting part, but the bits that make all the cogs work together. And that local frameworks and partnerships are integral to the way in which you need to operate going forward. And as part of that, one thing that comes through very strongly is obviously none of you are alone. So sharing your lessons and thinking through collaboratively how you take these things forward and not being constrained by economic boundaries and geographic boundaries is part of that conversation. But now the really hard work is starting to begin as we move forward into transition. And without further ado, I'll open up to the panel to start the conversation as to what successful transition might look like. Richard, if I might come to you first, would you mind sharing a brief overview of the LEP transition currently in Hertfordshire?
Well, as you say, Louise, we have been aware of change coming for quite some time. Government made announcements earlier this year. Gave us a long lead-in time to April of next year before you have the formality there. But I can't think of a better time to transition our LEP partnerships into a stronger entity involving local government, but not just local government, across all of the entities that have a significant influence upon the county. The County of Hertfordshire has a GVA of some 46 billion a year. Net contributor to the Exchequer, has virtually no unemployment, has about 60,000 small businesses. That is not to be taken lightly. That is not to be undermined. That has to be supported. If Paul Johnson has told us anything, we're in a relatively difficult environment, and we've got to find a way forward to drive growth where it is not naturally occurring. And so I can't think of a better time to work out how to do that together. And I don't think it is as simple as saying, right, all of those driving the economy, you go in that room, and all of those that are driving place and environment and connectivity are in another room. I think it's very much got to bring everybody together to try and get the best possible result.
Wonderful, thank you. And Andrew, you have a slightly different position, being on the LEP side, being a LEP chair. So would you like to share a bit about your journey? We actually used Buckinghamshire as a case study when we looked at LEP transition.
Yeah. Well, we've been on this journey. So the Chancellor was going to announce the abolition of LEPs in the autumn statement last year, and it got delayed to the budget. So we've been working very collaborative with the Council on merging the functions. So in Buckinghamshire we have a growth board which has 4 sub-boards, one of which is enterprise and investment, one is skills and training, one is town regeneration, and the other one is opportunity bucks, which is really addressing issues around deprived wards. So really what you just said here, actually joining it all up, will now allow the LEP functions, which will move into the council before April. I know that some LEPs are thinking that they should delay it and see what the announcement is, work on the basis there's not going to be more government money. I know that if he says, let's wait for the money, I've agreed with the leader of the council. So forget it. Let's just work on the basis there isn't going to be any more money. We've got the assets, we've got the people. What we need to do is to drive productivity, and I think that where Bucks has been where it's been very helpful is having just one geography. We've got one council. We can just sit down with the chief executive, with the leader, the cabinet, and just work things out. And that's why we are moving ahead. That's not the same with many other LEPs. I think they are having some difficulties, particularly if you've got multi-local authorities. But having one has been a huge, huge advantage. And that was certainly demonstrated during COVID, for example. So I'm hoping in the next few weeks we will be fully integrated with the council, because if we're not, the only thing that's going to suffer is productivity and growth, and that's what we need to achieve.
Yeah, fantastic. And Debbie, you're in a slightly different position. So obviously in Greater Lincolnshire you have gone for devolution and mayoral combined authority. How has that impacted on your transition with the LEP?
Yes, so we've got, thank you. We've got a really successful LEP in Lincolnshire. It covers Lincolnshire, it covers North and North East Lincolnshire, as well as Rutland. And obviously we're in negotiations with North and North East Lincolnshire around a devolution deal, which hopefully will get announced on Wednesday. And so we made the decision fairly early on that we want to transition into the new mayoral combined authority arrangements. We didn't want to change and then have to change again from the point of view of the staff. So we have been working through the devolution negotiations to arrange to transition the staff into the mayoral combined authority in 2025. So it's a little bit different. But I think it's fair to say that the authority is currently working incredibly well with the LEP. We've got some really strong business leaders on there. The priorities of the LEP are also the mayoral combined authority. you know, the cornerstone of our devolution deal is what the LEP are currently working on. So we've looked at developing a service level agreement across the various different authorities, and pretty much see it as a very smooth transition because they're focusing on the things that we want them to focus on anyway as part of the devolution deal. So I'd agree with what everybody else has said. I think it's a really good time to strengthen the LEP. I think what we need to do, though, is make sure that we hold on to and cherish the voice of businesses as part of that transition.
Yeah, great. And we'll come on to talk about voice of business because that's been really, really important. And Richard, if I may come back to you, obviously through talking about benefits of transition, you've talked about kind of the join up. But what do you think is going to really enable driving of growth?
Before I answer the question, I think we've got to just take one of the challenges, which is picking up. We're not across the County Council network. We're not all unitary authorities.
Yes, that's true.
And I think we have got to enhance business. We've also got to protect it a little bit, and that means that by all means, we need engagement from our district and borough colleagues with the County Council in these new arrangements, but we mustn't overwhelm business and drive business interest away with having too politicised a conversation. And so I think that's a key aspect to it. Equally, I think that the conversation, we've touched on it already. I think Tim alluded to vanilla Devo 2 deals for county councils, bringing together the various strands that will enhance the opportunity to build economic Hertfordshire, LEP 2, whatever you want to call it. I think it's going to be really important. And if I may reflect just for a moment, I think we are in a very, very different world to one of only a few years ago. It's post-Brexit, it's post-COVID. Behaviours have changed. We have a demography where there are fewer children being born and we have an ageing population. The value and the demand for resources for people to work in our businesses, which are not there at the moment, means that we've got to use all of our integrated strands to bring influence to bear across the various agendas to give business the chance to keep thriving in places like Hertfordshire.
Yeah, I think that's absolutely critical. And as we know, also the economy is significantly made up of small and medium-sized businesses as well, which I think it's probably fair to say we make it quite challenging to actually understand how to interact with the amorphous of different bodies that exist sometimes as well. May I come to you again, Andrew, talk about actually within those transitions, how did you sell it to the LEP board? Because you are kind of those business representatives. Obviously, the board's made up of mixed, but from a voice of business perspective, how did you actually sell that this was a good idea?
Well, I mean, I think obviously the Chancellor made his views very clear, so we're not going to go against what the Chancellor said. And so, you know, they had a very grown-up discussion. There's no money. We've only got the assets we've got. We've got a good working relationship with Buckinghamshire Council. You know, the leader looks after economic development, so it was a unanimous decision. And now it's the mechanics. Obviously, key for us is the people, and they will be trooping over, and then looking on how we're going to deploy the assets for economic development. And I think where Buckinghamshire Council has been brilliant with the leader is that the assets, and there's not a lot of them, but the assets that are going from the LEP and monies for enterprise zones, for example, have been ring-fenced for economic development. So they won't be touched for putting in other budgets like adult social care. You know, we've got 4 key economic sectors in Buckinghamshire: space, the screen industries, medtech, advanced automotive, and they are the bedrock for the economy. And we will continue to look into invest in those and work with other councils who are strong in those areas. It's interesting what somebody said about geography. You know, from a business, everybody likes to have a red line where you should go. In a business, you go where the money is. So for the film industry, you know, the 2 key councils for us, it's Hertfordshire and Surrey. For space, it's Cornwall, it's Oxfordshire, and so on. So you go where your strengths are. And I know government likes to put us in boxes, and we've had LEP reviews, and one stage we were going to Buckinghamshire was going to be putting up with Semlep and then over to the Fens. You go where the money is, just and don't be put in a straitjacket on geography.
Yeah, that came out quite strongly in our analysis and kind of talking, was actually that collaboration past geographies and how important that is, because you're quite right, businesses don't work like that.
Yeah, exactly.
Actually, we don't necessarily work like that as people. So those straitjackets, we can all come out of them. May I ask you, Debbie, obviously, again, being in a slightly different position, do you think that going for devolution is going to give you a stronger mandate from a growth perspective?
Yeah, I mean, I think, local authorities, mayoral combined authorities, we've always had a mandate in terms of economic growth for our areas. I think what devolution offers us, though, is the ability to plan longer term. Clearly, a longer term financial settlement, stability in terms of your strategic priorities gives you that platform for much wider long-term strategic growth and strategic planning. I mean, just another point, obviously, mayoral combined authorities, local authorities don't exist as islands neither in terms of silos. For economic growth of our area, it's absolutely essential that we have really close collaborations with our partners, both north and northeast in terms of reaching over the Humber Estuary, in terms of East Midlands, in terms of Cambridgeshire, Norfolk. It's vital that we continue to collaborate and be part of that infrastructure as well to support economic growth in our own areas. It's not about, devolution isn't about looking inwards, it's about having greater accountability and a single point of contact so that you can reach out to others as well.
Yeah, I couldn't agree more. And just coming back, Richard, on challenges, because you obviously mentioned talking about kind of the challenges. Within your view and kind of like how we drive that growth, we've talked about obviously the fact that businesses don't necessarily work in the same way and look at things differently. The voice of business came up as absolutely crucial in, from a department perspective. Obviously, if we're going to drive growth, we need businesses to be absolutely vital part of this conversation. How do you see the transition being basically a benefit to having that voice of business as part of the conversation?
I think I alluded to that in an earlier answer. I think the Economic Board, in a sense, has to have the freedom to be outward-facing, to be a voice that is respected by the business and commercial community, and that it provides the leadership that the rest of the business community can respond to. But in of itself, it is going to be a relatively small, I think, as you're referring to, in terms of its ability to invest, relatively small. There might be an odd cynic in the room, but government tends to pass things over to local government when the money's run out. So unless it can be self-generating, it will only have a relatively small pot. So I think it's all about making sure that the environment in which we want business to thrive in is right. And that means the education system has to have really good schools, good or outstanding, that the environment is looked after and enhanced, that actually we really care about the place where people live and work. And if we can make the sunshine a bit more, that's great, but not too much. So I genuinely, the elements that enable our young people to come forward to have the opportunities to move into and support a growing business community, I think is so important. And there will be linking that skills agenda, potentially a devolution deal would be ideal within this environment that links our university. We've got a great university in Hertfordshire, 33,000 students in there. Our 4 education colleges, again, thousands of students with bringing the skill set, but linking that across what the county councils, what the borough councils do, and what schools are doing in terms of bringing their students forward. I think all of that is an agenda that we would want to enhance through LEP2, but it's all of us to bring that strength to bear.
Well, you realise we're going to have branded LEP 2 by the end of the discussion. That's the new model coming. Is there any challenges that you've had that you'd share at this point in time, particularly?
I would say they're not huge challenges. The LEP has been really strong in Hertfordshire. It's been well led, great successes. It's brought something like 330 million into Hertfordshire in its 10-year existence, and I'm sure it will do that in the future. Some really important builds that help with the infrastructure of the county. I think the transition conversation is that little bit more complex in a two-tier system than the unitary that's been described. And I think that is the only sort of slight fly in the ointment. But I don't think that is insurmountable. And I think governance will be achievable. But I do think it is the right time to not just lift and shift, but actually to rethink. And I think that's where we are at the moment in Hertfordshire.
Yeah, we'll come back to that point, if I may, in a moment, because I think the point about kind of the rethinking and transition is obviously really critical. And again, appreciating that lots of places are unique and that where there isn't that coterminosity from a geographic perspective, there's been slightly different challenges that have been presented as part of that as well. So if we look post-transition and think about actually, what does success look like? So, Andrew, from a business perspective, what would you say success looks like? You've been LEP chair. What do you think is important to share for everybody kind of going forward as to how we can make this successful?
Well, I think one of the biggest challenge is money. I'd be very interesting to see how many leaders are going next Monday to the Prime Minister's Global Investment Summit. We've got leaders all over the world flying in with large checkbooks wanting to invest in the United Kingdom. And when I looked at the list, I thought, hang on, there's not many local authorities, and you guys, with us, are responsible for growth. There's already a disconnect, and we haven't even started the integration yet. I'll certainly be going. I'll be working the room and trying to get a little bit of investment for Buckinghamshire, or quite a lot of investment for Buckinghamshire. But I think that is going to be the key one. There is not a lot of money around, and so we've got to use it wisely and correctly. Success, I would hope that we would be investing in Buckinghamshire in terms of town centres regeneration and filling up our enterprise zones, particularly that at Westcott, where it's a great success story in terms of space industry. Our one at Silverstone is now full. We've got another one coming, another one which is embryonic, but yeah, that would be, in my view, the success, and getting more money.
And is there, just as part of that, a different role, do you think, from business? So obviously we've had businesses sit on LEP boards, take chair positions, and obviously there's the different governance structures that you've all talked about kind of being set up and working together. But is there a different ask, do you think, of business at this point in time? If it's a rethink, changing landscape, anything more you think that actually business can step forward and do as part of this transition?
Well, I mean, I think you've just even heard this morning, I think everybody understands the importance of having business representation.
Yep.
And LEPs have worked with their local authority partners since inception. So I don't think it's anything different. We will have to get accommodated with local government structures, which sometimes can be a bit clunky, but that's what the new structure is, and we will make it work. The key point here is we've got to look after the economy, growth, and productivity.
Yeah.
And that's, everybody's aligned on that, surely.
And Richard, from talking about success, is there anything that you would need from partners or government for future success that you don't have already?
I was just feeling what Andrew was saying. I think one of the most important things that local government doesn't do is get in the way, that it adds value. I think that's really important, essential. I think it is that we with government and with our partners that we optimise all the opportunities. So if it's inward investment, what is that for? We already have a successful economy. What's the next thing that comes along? We have a film, TV, media sector, which is second to none in the country. But we also have a nascent and growing bioscience sector centred around Stevenage, and again linking through to that Oxford-Cambridge arc. So regionally becoming significant. But what's the next thing? If you're going to retrofit 400,000 houses, which are currently probably below the levels necessary to retain a reasonable amount of heat in them, how are you going to do that? We've attracted £100 million worth of investment, but where are the investment vehicles for that to be done at even greater scale, and what makes that an attractive investment? The same could go for looking after an environment. If you want biodiversity net gain, how do you? Paul Johnson's saying build, build, build. Well, that's fine, but how are you going to sell that to your population, in our case of 1.2 million people, who may not want houses or factories? Actually, employment land's really important. Talk about success. Yeah. Employment land has been dropping in the county, and it's probably dropping in the southeast more generally as houses are built on employment land. That is something we can't afford. If business doesn't have the opportunity to land, it won't. It'll go somewhere else. So I think there are some really important drivers which we will need to make sure that they're not being overwhelmed by other priorities. Yeah. Ultimately, if we want our population to succeed, they want a job, they want a decent job, want to earn a decent living, and for that to take place in a decent environment. So I think there are some. Our task is both to be really supportive of that infrastructure that doesn't then get in the way, but it's got to be supportive of business coming in and inward investment into our counties.
Yeah, I think it's really important, isn't it? Because it can get so it becomes very difficult rather than easy, and we need to make that a safe and easy place to do business effectively. And Debbie, if I may come to you, and as said, obviously from a devolution deal, it gives you a slightly different platform to kind of have those conversations. Whether that's right or wrong, that you have to go through devolution to get more responsibility over economic growth. In practical terms, as you go through that transition, what do you think might be some of the challenges that will more easily be overcome because you've got that devolution structure around you to enable kind of that more joined up working?
Yeah, I mean, I think devolution, as I've said, offers that long-term strategic planning opportunity, but it also enables much more localised decision making as well. So I suppose in terms of one of the opportunities that we see across Greater Lincolnshire, and Richard alluded to the skills agenda, you know, our current education system is not preparing young people in particular for the jobs that are available in Greater Lincolnshire. And so how can we work with the sector through the devolution deal to be able to provide a different skills offer so that young people can thrive and can have highly paid, highly skilled jobs and be prepared and ready to work. So I think it offers some of those opportunities for greater local decision making. But again, linking into what everybody else has said, that bit about making sure that we do continue to bring the businesses on the journey, we listen to what they want, because we can only design an education system through our devolution deal by listening to employers in terms of what skills they want. So I think it is about greater collaboration, but more local decision making means that we can have greater influence about what the economy needs for Greater Lincolnshire.
Yeah. And do you, on that, Debbie, think that you've got almost more of a strategic right because of devolution to do so?
I mean, I think as a local authority, we have that right anyway, don't we? You know, we've got the democratic mandate to have that right.
Yeah.
And so I think devolution clearly reinforces it, but I think local authorities have got that democratic right and should use it.
Yes, yeah. And again, that was something that came up really strongly as we were talking and engaging on this transition, was the fact that actually, you know, as local authorities, you do have that right across driving strategic economic growth, albeit actually it's been quite challenging. And also, if we talk about kind of investment, the challenge to get kind of investment at the right time. I'm going to ask you to just think about reflection as the last couple of points you'd like to make, and then I'm going to open up the floor for questions. But before I do, and slightly off script as well, we've talked obviously about the fact that there's a challenge with finances, and all of you in the room obviously are in a position where actually the financial challenges that local government is facing is really difficult at the moment. So to make this work, finance isn't always the silver bullet, but do you think that there needs to be funding that follows some of the transition? Because that has been something that's kind of been a little bit left on the table so far, where everybody's kind of said, we think, you know, we'd like funding, but actually we don't necessarily know what's going to flow down, or if anything's going to flow down, with the responsibilities that you'll take from having the LEP functions. So any views on that as last question, and I'll ask you just to share a couple of reflections.
Well, I wouldn't hold your breath on extra funding, I'm afraid. So therefore, we've got to collectively be imaginative and working together, looking at other funds out there in the private sector to grow. It would be a lovely bonus if the government chancellor announces something, but if it is, I don't think it's going to be a great deal of money, and it will probably just be for headcount.
Yeah.
Yes, more funding for economic Hertfordshire would be great, but let's be realistic. I think probably what's as important is that we advocate around infrastructure. So particularly in the southeast, those bigger counties, our highways infrastructure, or is it our digital connectivity? What do we need to make sure that's happening that optimises the chances for business to land and go, yep, this is the place we want to be. And there will be different challenges in different parts of the country, but I think it's those funding streams that come with that, which ultimately are going to be nationally driven. I think those are going to be so important for the future.
Yeah, yeah. And I think one of the challenges, again, that we've seen is and the combined authorities still face it, the almost competition that comes with some of that as well. So actually there is a balance in managing that kind of competitiveness versus actually striking up the opportunity for growth. Debbie?
Yeah, I'd agree with everything that everybody said. You know, local authorities need to determine their priorities in terms of what's important, and if we believe in what we want to do, then we'll find a way to do it, mainly through collaboration as well.
Yeah, great. Right, brilliant. Any final reflections from each of you?
I would just urge people who are going through this to get on with it. There's a lot, there's a lot of uncertainty for LEP colleagues. And move on. I know there's some resistance by some LEPs, but get it integrated sooner rather than later, and then we can start growing the economy again.
Yeah, great.
I would echo that. I would also say in a two-tier system, we have a growth board looking really carefully at the moment about what are the most important priorities, what are the real missions for the county, and then making sure, in a sense, that, right, this is what we want for a world-class economy, off you go, Economic Hertfordshire, deliver to that agenda. Thank you.
Right.
Yeah, and I think the only thing I'd add to that really is that as leaders in our area, we need to give confidence to the businesses. So during the period of transition, I think it's important that we communicate so that businesses do know what it's going to look like, and we harness their views as we move forward. But just during transition, we need to make sure that we speak and engage with them.
Yeah, I think that's they're all brilliant points. I think get on with it is definitely a good one, and that leadership point, which also probably comes back with you may lead. Now's the time to take that destiny forward. Can I say thank you to the panel? We'll come back and thank them properly at the end, but I'll open up the floor now for questions. We'll take a couple of times, one at the front and one in the back first. Thank you. And I'll come to you in a second, so in the middle. Sorry, Mike, right down the front, just down the front here, please. Front row, thank you. Great, thanks. You, yes, please.
Hi. Ben Bradley, leader in Nottinghamshire County Council. I think we're pretty terrible as a sector at our engagement with the private sector and investors, and we've become very reliant on government grants to deliver projects that actually would be commercially sustainable and viable. Levelling Up Fund is a good example of where we're all waiting to be approved or not approved. We could just kind of get on with it. How do we build something then, whether as LEP integrates with local authority or in our case in East Midlands, as like yours in Lincolnshire, Debbie, into a mayoral combined authority? How do you build something that is more engaged with the private sector, that works with investors to perhaps deliver some of these propositions where currently we might be waiting for the taxpayer to do it?
Yeah, great. Okay, we'll take one more question. So there's one in the middle. And
Thank you. Yes, Kevin Bentley, leader of Essex County Council. I have the great fortune to be in the biggest LEP in the country in Sellet with my good friend Keith from East Sussex and Roger from Kent. It is the economy the size of Belgium. The politics is easier than Belgium, I would say. My question, though, to be honest with you, is in terms of when the LEP transition takes place, do we see the LEP still being a separate part of the local authority, i.e. is the chair independent? Or is it a politician? And where you have a mayoral combined authority, and Ben is one of those, do you see that competency going straight to the mayor?
Great, okay. Lovely, thank you. So who'd like to start with the question on engagement with the private sector?
I'll take that one.
Yeah,
right.
great.
Yeah, I mean, I think, as you're quite right, you say, there's been a number of government grants or funding schemes over the years, Growth Fund particularly, but there are sectors of the economy which are growth sectors, and the Prime Minister has set out the 5 key growth sectors. Luckily for Buckinghamshire, the film industry is one of those. So I think that in terms of getting a balanced economy, looking at those 5 growth sectors is important. And the film industry is very much around London and the South East. But regional filming is really important. So if you get the right sectors in the mix of the economy, and things such as next week's Global Investment Summit, we've got the biggest investors in the world coming who want to invest in the UK. So engagement early on is critical. And on the second question,
yes,
I'll tell you what the model
please.
in Buckinghamshire. So Growth Board's chaired by Martin Tent, the leader of the council, and there will be a deputy, which will be a private sector, and then the investment and enterprise part of that will be chaired by the private sector, and the private sector will have a majority on that, but the policy would be set down by the Growth Board. And I say the money has already been ring-fenced, the LEP funds, for economic development. And, I mean, that's not the case in all LEPs, but that's the one I think will work very well in Buckinghamshire and is probably a good model.
So the discussions that we've been having as part of our devolution conversation and the governance around that would be that we would have a business board established that would be chaired by a business, and that individual then would also sit on the mayoral combined authority as an associate member, so wouldn't have voting rights on the mayoral combined authority, but would sit on the board, is the model that we're looking at the moment.
So there are so many different models of local government, aren't there? There's no single model in the room. I don't have a preferred view other than if the chair of the economic board is truly independent. Then I think that's, why not that being a business person? If business feel that having the leader of the council chairing their board brings a gravitas to that, then I can see the advantage there as well. So, but either of those work well. I think in terms of investing back in, obviously private investment, let's make each and every one of our counties as attractive as possible in their own unique ways. Yep. I suggest that governments now and in the future will behave just as they always have done, and they will still, despite devolving monies, whether it's Greater Manchester or East Midlands or whether it's Birmingham, they will still have pots of money which they will want to largesse around the country. Levelling Up funds are one example recently, but there will be others in the future. And I think it's making sure that we have shovel-ready schemes ready to go, or opportunities to be invested in, whether that's the private sector or for government. Our role is to make sure that those are ready.
Yeah, great. And it takes an awful lot of time and effort to compete and bid into all of those different funding pots as well. So there's definitely an opportunity for some economies of scale as part of that. Further questions, please. The one in the middle. Great.
Yes, hello. My name's Paul Marshall. I'm the leader for West Sussex County Council. As a leader, the economy is part of my portfolio. I think I'm particularly pleased that the LEP is transitioning, strengthening the role, particularly at the county level. I think for me, whenever I go to any business forums, and I was on the board of the Coastal Capital LEP recently, and what I find sometimes the business community says, we don't want local authority involvement, but they always sum up at the end of their forums their biggest challenges. It's access to labour, access to skills, it's infrastructure, and that includes digital. So I think there's a real, partnership to be worked there from a county point of view and a wider area. We do have a responsibility around that macro opportunity, and then it's enabling businesses to take up those opportunities for themselves. So for me, I just want to say, your discussions really resonated, and the journey that we're making ourselves, we are undertaking that. I'm hoping government will provide some funding, particularly around the Growth Hub, which is there, and I think that's really key. As for the Careers Hub, we've already integrated that. But you're right, Andrew, in the sense we started that journey. We don't need to wait until somebody gives you a brown envelope to say that's what you've got, because those opportunities there. The other key point for me, I think, is as a local authority, what our responsibilities is to make our communities prosper. And if we talk about labour, and Paul Johnson mentioned that earlier, as local authorities, we need to provide housing. Now that's an unattractive word in some contexts, really there, but if you want to attract labour, you need to provide them good quality housing, good quality education, good quality health facilities, as well as a public transport that can migrate. So I just wanted to say thank you, and I resonated with a lot of what you said.
Wonderful, thank you.
I do genuinely think, business and local authority, it is a partnership. One of the things that we have found in Buckinghamshire through our growth board, people think Buckinghamshire is a very wealthy county. We've got 10 deprived wards. And, the leader of the council, the chief executive, we went up to look, I think a place called Horton near Durham. It's the most deprived ward in England, learning what they're doing and how we can do that here in Buckinghamshire with business. So there is that linkage of, helping the local authority deliver on some of the issues which business wouldn't normally actually be concerned with.
Yeah, absolutely. Wonderful. Thank you very much. I think there's some very clear points that have come out through the discussion today. As we know, the transition journey is not going to be the same for all of you, and some of you might have a slightly smoother transition path than others. However, there's obviously opportunity through this, and we've talked about joined upness, we've talked about collaboration, we've talked about how important that voice of business is. So I wish you well on your transition journeys. Love to hear more about how you're doing, and I encourage you to share and talk to each other and learn from each other, because there is lots that can be done collectively as well. So may I ask you to say thank you very much for panel members.
Okay. I'm very pleased to present the Labour view and very pleased to have Baroness Sharon Taylor here. Baroness Sharon Taylor has been a Labour member of the House of Lords since 2022, joining the front bench as a whip in January 2023 and a shadow local government spokesperson in February 2023, and is now the deluxe spokesperson in the Lords. She was first elected as a member of Stevenage Borough Council in 1996 and went on to serve as leader of the council between 2006 and 2022. In 2008, she was also elected to Hertfordshire County Council. Prior to entering politics, she worked at Hertfordshire Constabulary, John Lewis and British Aerospace. And in 2013, she was awarded an OBE for services to local government. So please welcome Baroness Sharon Taylor, who will speak for 10 minutes, and then we'll have time for a few questions afterwards. Thank you.
Thank you very much, everyone, and good afternoon. And it's lovely to see so many familiar faces out there. It's great to be back with my local government family. I'm still a county councillor, so I will be until 2025. Before I start on my talk, I've been sitting in on a bit of the last session, and I just wanted to give a big shout out for the Hertfordshire County Council and the Hertfordshire LEP. Pulling together the Herts Growth Board hasn't always had the smoothest of paths, but it works really, really well. Richard, the leader of Hertfordshire County Council, and I have very different political persuasion, but that hasn't got in the way. And because of what Richard and his two predecessors and the LEP have done, we've been able to get a £1 billion town centre regeneration project underway in Stevenage, and we're now bringing in more venture capital to Stevenage than anywhere else in Europe, which I think is a real achievement. So I'm very grateful to Hertfordshire for that. Now, it was several years ago now when I was acting chair of the LGA Resources Board. I went to do a radio show interview with Nick Ferrari on LBC. Anyone know Nick Ferrari? He's not known for having views which would come anywhere near mine politically, so I was a little bit nervous about this, and he can be very outspoken. The first thing he said to start the interview was, "Government treats local government appallingly in terms of funding. I don't know why you council leaders don't just march up to Downing Street with the keys to your town halls, hand them in, and tell them you can't do the job on peanuts." That started off on the right foot for me. We got on fine after that and even discovered that we have a liking for a blues singer called Christine Perfect in common, so we got on pretty well from then on. I was a council leader for 16 years until I stepped down in December 2022 and I was appointed to the Lords. I'm still a councillor and a county councillor. Since 2010, the situation regarding local government finance has really gone from bad to worse. I don't need to tell any of you that, I know. Our challenges in local government are shared across the country. Adults and children's social care, and I'm very pleased to see the education, my education panel chair is here, Caroline Clapper. They've gone skyrocketing, and the costs of providing them to a level which is safe and sustainable becomes ever more difficult. The CCN report from work carried out by ISOS shows exactly what we are experiencing in Hertfordshire, that as we all in the sector predicted, SEND and home-to-school transport are driving the next financial emergency. Your report, which I thought was very thorough, by the way, shows a tripling of costs to 1.125 billion over the next decade, driven by rising numbers of SEND pupils, parental expectations for individual transport. Councils are warning that their transport budgets are spiralling out of control. We cannot underestimate the urgency of tackling this. Setting up negative reserves just kicks the can down the road, and for every child left waiting months or years for an EHCP or for the provision they need, we risk a fundamental impact on their life opportunities. Let's hope that during the course of the conference, we persuade Mr Hunt, when he gives his autumn statement this week, that an emergency injection of cash is really genuinely needed. Then there are our other challenges. Where to build enough homes to tackle the homelessness crisis. And I heard the Managing Director of MACE, who is one of our key partners in our regeneration scheme, speaking on the radio this morning, talking about an urgent need to provide help with rent to buy. So that's another point for the Chancellor if he's listening. How we meet local needs for housing, how to get the infrastructure to support that housing and our growing businesses, how we tackle climate change and ongoing provision of key utilities, town centre regeneration, growing our key business clusters and making sure businesses get the skills and training support they need. I heard lots of discussion about that earlier. And ensuring our communities and the people and businesses that make them up are safe, feel safe and can plan properly for the future with a degree of stability. We will do all of this best if the powers and resources we need are devolved to the local areas who will always make better decisions than if those are taken centrally in Whitehall. The seismic shifts we are seeing in our economy, our culture, our community and our environment are rocking and breaking the mechanisms that were in place to govern them, which were designed for a very different time and a very different country. Just thinking about the digital, medical and green revolutions, it's no surprise that we need to reimagine the way our country will work in the future. We currently live in the most centralised state in Europe. For me, perfect examples of this come from my German and French twin towns, which are in the Rhine Valley and Burgundy. You might see a theme running through those. I do have the International Cooperative Wine Society in Stevenage, and they grow the wine that comes into there. Our French twin town, which is in an area with equivalent protections to the Lake District in this country, the Morvan Forest area, was able to conceive from a glint in the mayor's eye, build and deliver an agricultural conference centre, a huge agricultural conference centre, within 18 months. I doubt if you could do that in 18 years here. And our German twin town, which is home to Boehringer, a large pharmaceutical company, benefits from having almost all of the business rates generated by that company for the development of the town. You should see their reserves line. Oh my goodness, it's to die for. I mentioned the Levelling Up Bill, and while I'm sure there were very good intentions for it, and I've been working on it solidly since last January, we finished it in October, as many of you will know. We all hope it will fulfil some of its promise. Unfortunately, our fear, those of us that have worked closely on it, is that it will be a huge wasted opportunity because it was conceived by a government that fundamentally doesn't trust local government. You can't level up from the top down. Therefore, it goes in the wrong direction, centralising much of the decision-making and funding instead of putting power and resources into the hands of communities, towns, cities, regions and nations. So we need a strong principle of subsidiarity, so decisions taken at a level as close to people they will impact as possible. We need a system that engages people and businesses far more in decision-making by encouraging participation and using the power of digital engagement. We need root and branch reform of central government to break down the silos and barriers between departments that sit at the heart of so much delay and confusion. And, for example, I didn't realise when I went in there that I can't deal with anything to do with SEND, children's services or education, or adult social care, things I've dealt with all the time I've been a county councillor. They don't sit in the DLUC department, they sit in their own departments. And you need more radical reform of local government finance. At the moment, more than half of councils are cutting spending. 50% say there will be service cuts. There'll be increasing commercial investment, which incurs its own risks, as we all know, and spending reserves. 67% of councils plan on using reserves to make next year's budget balance, and 80% of those also used reserves last year. More than 90% will increase council tax, a majority by the maximum amount, fees and charges, or both. And just under 1 in 10 councils feel the financial constraints represent a threat to their ability to deliver statutory services. Even more worrying, and I was interested in the question about what hope we saw coming over the horizon in the autumn statement, only 14% of councils are confident of the sustainability of local government funding, and only 8% believe government will prioritise local government funding in the autumn statement. Increasing percentages of our funding are being spent on specialist services that only touch a small minority of the population. For example, the huge inflation in the cost of home-to-school transport and SEND is sucking money away from the universal services that all council taxpayers will see. The key areas of pressure are housing and homelessness, children's services and education, and environment and waste. As I said earlier, in the longer term, we need a radical devolution of powers and resources to local areas so they can take the best decisions for their local areas. This means looking at the current silos that exist between departments in government. In the short term, we need longer-term funding settlements that reflect current and future demands and based on need. Multi-year and timely settlements so councils can plan and make meaningful financial decisions. Clarity on funding streams, it's just not good enough to allow the councils with the deepest pockets to be able to fund consultants to put bids together for them, so we achieve the opposite of levelling up from Hunger Games style funding rounds. A renewed focus on prevention to address existing and future demand for services such as social care, homelessness and community safety. If addressed now, we can tackle the acute financial challenges faced by the sector and halt the long-term decline in local public service provision. This will ensure local services are sustainable, but it also has the potential to reduce costs falling on other public services, an argument I've been making at least since 2015, probably longer than that, and support the local delivery of our major challenges on housing, levelling up and climate change. So we don't hand back the keys, do we? Because we, first and foremost, want to serve our communities. No one becomes a councillor to make cuts or agonise over budgets. So we will carry on helping our communities through the cost of living crisis, driving economic development in our areas, ensuring all our children and young people get the opportunities they deserve, reforming adult social care and dealing with housing infrastructure and net zero. But it wouldn't be bad to have a little bit more help as we do all of that. Thank you.
I'm conscious that lunch is awaiting us, but we do have time for a few questions if anybody has one. David. Okay. Gotcha. Any other questions? If you could put your hands up.
Thank you very much. And I don't think most of us in this room would disagree with a lot of the analysis there. And certainly we welcome the thoughts on devolution and passing powers down to local authorities, local areas. I just wonder how that sits with the Fabian recommendation of a national care service and what the Labour view is of that at the moment.
Well, Labour's still developing our picture on a national care service. From my personal point of view, I think the devolution, we need to do a lot more work on the devolution, talk to all the sector, work out how we're going to do this. It always is going to involve with care, with health, probably with education, minimum levels of service. So if the National Care Service is there to make sure we deliver that, then that would be a good thing. But that should be done with the ability of local areas to develop the service that works for their area. It won't be the same in Hertfordshire as it is in Manchester. It won't be the same, you know, in across much of the country. So we need to have the space to develop our own ideas. And if you're too prescriptive about things, and I have to be honest and say we have seen this in previous Labour governments, you stifle the innovation, and the innovation is really key to this.
Thank you. Ruth.
Thank you. Ruth George from Derbyshire. Probably linked to that question is about how a Labour government are looking at prevention rather than cure. We just saw from Paul Johnson the huge amount of spending on health that's projected to come in, but that education is due to flatline. How would Labour make sure that the services county councils provide in terms of SEND, in terms of children's early help services and in terms of adult social care can really be used, and you can use our expertise and work to benefit sectors elsewhere and reduce spending elsewhere?
Thank you for that really important question, Ruth. It's one of the things I really care passionately about, because I think there's so much in the system, and I'm going to take an angle on this from the domestic abuse point of view. If we deal with things early on, with people that are suffering from domestic abuse. You can prevent the young people and children that get caught up in that and save so much money down the line. And I did a report on this back in 2015. It was for Ed Miliband, actually, but I worked on it with the leader of Manchester City Council and the leader of Hackney Council. And we made some very clear recommendations about just how much could be saved to the public purse if you took a prevention-based approach to public services. The reason I mentioned the silos in government is it's quite difficult to do that at the moment because of the way that national government is set up in the departments. So it would need some fairly radical reform of the way that the national government departments work, either better working between them or a more radical approach than that even. But it's really important because you limit life chances, and when you the case we always used to quote was there was a family in Oldham that had 148 different interventions from different bits of the public service, and none of them had actually got to the root of the problem.
And can I give the final question to Roger Goff from Kent County Council? Oh, no. Oh, sorry, it was Martin Hill. So, did you have a question? No? Oh, sorry, it's one.
Sorry, I did have one. Welcome, Sharon. Nice to see you
Hello,
here.
Stephen.
Stephen Giles Meadows from Hertfordshire. You mentioned about multi-year settlements. The other thing that we have on authorities is the problem of bidding wars. If you don't have anything already prepared, you don't know what's going to come out, we need to end that bidding war process. So we have clear guidance from year one what is going to be needed. The pothole fund money came out last week. We're told in Hertfordshire it's 87 million. However, that equates to 8 million a year. But then Treasury says, oh, you're only getting 2.8 million next year. So in other words, it's a bit smoke and mirrors, and that does not help us deliver services when monies are coming out late in the year.
It wouldn't be you, Stephen, if you didn't talk about potholes when you stand up. But you're spot on with the bidding rounds. It's something that frustrates everybody in local government, I think. And when we got the figures through, that I think something like 26 million had been spent on consultants to do the last round of the Levelling Up funds. That's money that gets wasted and could be used to support our local communities. So we really do have to make sure that we've got a longer-term funding settlement that takes account of the needs. I agreed with what Richard said earlier. I don't think we'll ever escape from these little pots of money coming out every now and again, but the more they can be limited and our basic, our business case is accepted, and then we get the funding that meets what we need, the better.
And I think we'd better call it a day there because I know lunch is waiting. But many thanks to Baroness Sharon Taylor, who will be hanging around for a few minutes if anybody does have any further questions. So thank you again.
Good afternoon, everybody. Good afternoon. Can I welcome you back from your sessions? This next session is about how we look at healthcare, social care reforms going forward. This morning was setting scenes, the rest of it, and it gives me great pleasure this afternoon for this session. I'm Councillor Jerry Roodhouse. I'm a Vice Chair of CCN, and also the new portfolio on public health, which has been created within CCN. We're all aware of the pressures. We're all aware of the particular demographic change, and we've seen all that this morning. So this afternoon, and some of the questions from this morning were setting up this afternoon's session as well. So it gives me great pleasure to welcome Nadra Ahmad, who's the chair of the National Care Association, who represents small and medium-sized care providers and affiliated local associations. Nadra brings over 40 years of experience in social care to a post that she held in 2001 there. And we're leaving Nadra to the end because I think it's going to be quite interesting to see what the view is. Nadra's told me she's made no notes, no nothing, and is going to be just seeing what the other two say, and then going to come back and give that perspective. So that could be an interesting one. Hopefully joining us remotely is the Right Honourable Damien Green, who's been an MP since 1997. He's held posts with David Cameron, Theresa May, and worked on social care reforms as well, and has been chair of the All-Party Parliamentary Group for Adult Social Care. So again, he'll be bringing the perspective there. But first, I'd like to welcome Andrew Harrop, who's the General Secretary of the Fabian Society, Britain's oldest think tank and closely associated with the Labour Party. And earlier this year, Andrew authored a report for the Fabians and how to put in place a national care service. And I'd like to invite Andrew now to take that on, and he's got a few presentations to make. Also, hopefully there'll be time for some Q&As, but I've been told it's a hard stop at 3:45 for the next session. Andrew.
Thanks, Jerry. Good afternoon, everyone. So about a year ago, the Fabian Society was asked to develop proposals for a national care service, reporting to both Unison Trade Union and to the Labour Party Shadow Health and Social Care team. And it was a huge pleasure to do that. It's an area that I've worked on for over 20 years, and it finally felt that there was an opportunity to come up with a big comprehensive plan for change for adult social care. Before our report, the phrase National Care Service had been used repeatedly over more than a decade by politicians, particularly the Labour Party, but the Scottish National Party as well, north of the border. But until our work, it was just a phrase, and we've turned it into a plan. And what I want to do today is to spend a few minutes telling you about that plan. But first of all, I want to tell you what our proposal for a National Care Service is not. It's not a proposal for central government to take over things that local government does. And it is not a proposal for the NHS to take over things that local government does. Instead, we want to create a movement, a partnership, where everyone interested in adult social care is working together behind the new standard, the new strapline of a national care service. And as I outline the proposal, I hope that it is something that everyone in this room will feel there is something in for them, and that we sort of, if you like, it is a party political proposal, and that it's the Labour Party's sort of like proposal going into the next election. But I hope coming out of the election, if they are elected, it is a plan that people of all political parties and none can get behind. The work that we did was to sort of started off by looking at what's wrong with the current system. And I'm not going to rehearse that in great detail because you know as well as anyone the deficiencies of adult social care in England at the moment. But we tried to contrast that with what could a successful system of social care look like in the future. And there are some clear elements that I want to describe. Firstly, national leadership alongside local leadership, so that the Secretary of State is responsible for the outcomes just as he or she is with national health services. Clear rights and entitlements and the ability to enforce them so that everyone knows what the deal is for them. geographic consistency, so that there is a service that delivers broadly similar outcomes wherever people live, with similar resources wherever they live. A single public service, ending the fragmentation of social care that we have at the moment. So although there would continue to be tens of thousands of providers delivering social care, over 100 commissioning social care local authorities, but everyone working together as a national service with common standards and expectations. The way I try to describe it to people is, I come from London. In London, nobody knows that the buses are delivered by dozens of different companies because they all have London Transport on the outside. And that's the principle we want to have for the National Care Service. So all sorts of complexity and diversity in who's delivering, who's commissioning, but a single customer experience for people needing support and services. A service that is for everyone. And I think that this is a critical change from where we stand today, where we have our means-tested social care services that turns people away if they have more money than the current means-tested thresholds will allow to receive support. So that this is genuinely moving to a universal service so that everyone, regardless of their means, knows there is help available for them. Perhaps the point that you in this room will care about most of all, sustainable finance, so that you know that there is money available to do the things that we're promising the public. Second last is a national workforce settlement. And I think that so many of the problems that adult social care face at the moment is the failure to invest in and support people who work in social care. And the conclusion that we reached in our work is that that will only change and improve if we have national responsibility for terms and conditions and pay set through national negotiation with government, with providers, with trade unions, and with you in local government, setting a framework that is there for every care worker wherever they live and whoever they work for. And finally, action on affordability, on charges for social care. And I say finally because our view is that that is an issue that has too dominated debate on social care over the last decade. And although an important issue as to whether people should pay more or less for the services they need and receive, it's been allowed to dominate to the expense of everything else over the last 10 years. We think that services should be more affordable for people with some means, but that's a reform that should take place gradually over time as affordable and only as we progress wider reforms of the system. My thing's like, there we go. To turn all this into a sort of a practical plan, we set out in our report 10 building blocks, and underneath those building blocks, 57 recommendations. Now, you'll be very relieved to hear I'm not going to run through all 57 of those recommendations. But just to give you a flavour of what I mean by these different building blocks, structure and identity is basically to have a common brand and national leadership, as well as retaining all the existing institutions in social care. Workforce is about that new national settlement I talked about. The proposal is that we would have a fair pay agreement, a sectorally bargained agreement for everyone working in social care, whoever their employer is. And then after that, over time, moving towards National Health Service style terms and conditions and pay bands for those people in social care who receive public funding, who work for employers receiving public funding. Also workforce planning, higher training standards and regulation. Co-production is about making sure that the people receiving services and their families are involved at every stage in both national decision-making and local decision-making. Rights is about better understanding and enforcing the rights that exist already in the social care system, but it's also about introducing new rights so that people know they have a right of accommodation of their choice and a right not to be isolated, trapped in their own home. Carers is actually very similar to rights, but it's about family unpaid carers, not just the people using services, that they have clear rights and understand the system better, and are also referred into the system much more regularly and routinely. Access is probably the single biggest deficiency in the current system and the biggest area for reform, so that there's open access, preventative access to services that help people stay independent in the community and support people in their homes before they've even had an assessment for eligibility. That eligibility is assessed more consistently, and so that people at an earlier stage of needs get services, so that the amount of support available actually meets their needs, and so that there is good integration with the NHS, so that we really do have the people who have complicated health and care needs joined up provision to meet them in the round. Models of support is about innovation. It's about not just accepting old ways of doing things, but a culture and systems that continually deliver improved, better practice, led by frontline professionals and people using services working together on things like housing, technology, better use of direct payments, and making sure we have that integration, joint teams with NHS colleagues as well. Providers is going back to that point I made about a national care service that knits everyone together, so that we have clearer supervision of providers at national level, particularly the big providers where individual local authorities aren't well placed to supervise the work of the whole company rather than the local settings, but also you leading local partnerships, so that rather than a traditional procurement relationship, you're working with all your providers to shape the web of services locally, to improve standards, to improve training for everyone working in social care, to discuss how the workforce in retention, recruitment, good quality entitlements for workers, and doing that in a partnership, reshaping services strategically in the way that you want to, rather than just in a traditional buy and sell relationship, so that it really does become a national public service. Affordability, I talked about earlier. It's not the first priority, but it is important that we address charges, and we make a series of suggestions that we think politicians should consider after the election, rather than making promises before an election, which, as we've seen previously, have so politicised and charged the debate on adult social care. We don't want another election about death taxes. We don't want another election about, sort of who's going to deliver totemic promises that they never actually end up delivering. We give a series of ideas. One I'll just leave you with that we think could be a fairly affordable short-term change for shortly after an election would be to at least make short-term care free. The first 6 or 8 weeks, which at the moment is sometimes free and sometimes not, depending on practice locally, but it could just be an easy national entitlement. And the final building block, which I want to leave things on, is, of course, money. We know that nothing I've said over the last few minutes will be possible without there being more money in the system. And I have been very clear to Labour politicians that's true, that if they want to improve adult social care, it means more money, but it also means spending that money better. And we're realistic that there won't be a huge one-off injection as soon as there's a change of government. The most likely outcome is that there will be a stabilisation investment just to keep the system from falling over, given the challenges it faces. But we argue in our report that there also needs to be a sustained commitment over 10 years for year after year increase in spending above inflation to make sure that there is the catch-up and the improvement to deliver the vision I've been talking about. So not one big uplift. Unfortunately, that's not a realistic expectation, but change over time, a decade of better spending year on year. But linked to that, not just more money, but a different way of sharing the money. So there is no way, this is actually the single most nationalising thing about these proposals, to make sure that we have national funding formula just for adult social care, a national grant just for adult social care, and a national investment fund, so that there is capital expenditure going into social care for technology and new facilities as well. And if that all comes together, I think we can start to deliver the vision that I've been talking about over the last few minutes. I'm not going to go through the slide. I think I've gone over my time already, but you can see the list of issues that face local government in terms of your delivery of this national vision: money, the partnership with the providers, how to make sure prevention and housing and public health are all part of this, earlier support, working with service users, working with NHS colleagues, and making sure this is a universal system for everyone. And that means expanding who you assess and manage care for, even though initially people would still be paying for the support they receive. It's called a roadmap because it's a long-term journey. This won't happen overnight. It will be at least a decade to deliver the full vision I've talked about over the last few minutes. But the important thing is that we start with both stabilisation to make sure the system doesn't get worse, but also planning for the medium term, a series of ideas that we hope will very quickly be consulted on, and then turned into policy ideas and white papers, then turned into legislation. And as that happens, also great innovation on the ground and money coming in from national government. And the money won't necessarily come immediately, but it has to come over the course of the next Parliament for us to deliver what we all want to do, which is to deliver brilliant services for people with support and care needs. Thank you.
Thank you very much for that, Andrew. I don't know whether the technology is working. Damien coming on beat. Oh, good afternoon, Damien. I can just see you on my screen. Can we welcome you to the CCN? And over to you to tell us the next steps.
Thank you very much, and I hope you can hear me. I can now hear myself coming back 2 seconds later. But, oh no, you've stopped now. That's good. I imagine I'm a disembodied head on a large screen at the end of the room, because we've all been there in the audience for that. So, good afternoon, everybody. Thanks very much for inviting me. I'm speaking in my capacity as the chair or co-chair of the all-party group on adult social care, which, you know, the clue is in the title. It's an all-party group, so we try to avoid political partisanship, and we just try and promote the interests of the sector. And what we are working on at the moment is a report that will come out in the new year, which attempts to pull together some of the various very good reports that have been produced by many bodies, including the Church of England. The Archbishop of Canterbury set up a special commission, and various other people who are more permanently involved in the care sector have done the same. And we're trying to produce what we think of as a consensus report sometime in the new year, which will pull together all the various bits of thinking that have been going on about social care over the past few years. And obviously, it would be tremendously welcome if we could get the CCN's ideas on that as well, both from this conference and I know from the work you all do on a day-to-day basis with this hugely important and ever increasingly difficult part of a county council's job. So therefore, your thoughts on it would be hugely valuable. And I think we're deliberately producing what attempts to be a consensus report, because we are conscious that we are in a pre-election period. There will be an election sometime next year. And as Andrew has just said, the history of social care being used in election campaigns is a terrible one for the party that comes up with any original ideas. It happened to the Conservative Party in 2017. It happened to the Labour Party in 2010. And therefore, I imagine that both major parties have decided that now is not the time for interesting new radical ideas about social care. So we should be realistic about that, but I'm absolutely determined on a personal level that social care shouldn't just disappear off the national political agenda. It is still not only hugely important, but is going to be ever more important. We can all look at the demographics, And also, it is a system that has been creaking for years and is increasingly creaking and deserves more attention from any government than it has had for decades, in a way. It's been at least 20 years that we've seen problems emerging, and we've not yet done anything like enough to make sure that the system has some long-term stability in it. And you've heard Andrew's, if you like, suggestions from the left. The Fabian Society has offered this report to the Labour Party, and in the spirit of consensus, I didn't disagree with everything he said, and I thought some of the points Andrew made were exactly on the button. But I do think that the problem with the phrase, if you like, National Care Service, is that, as he said, it has over time meant many things to many different people. And if it does just become a rebadging or a new coat of paint on anything like the existing system, then that will be disappointing. But even more so, people will think, and this is one of the reasons why I slightly jib at the phrase, oh, the National Care Service, okay, and that's the same as the National Health Service now, so it's going to be free at the point of use. And at that point, you are taking away one of the sources of income that is there, even in the current underfunded system. And people will be terribly disappointed when that doesn't happen. And one can have admirable ambitions to promote partnership and all work together. And even, and again, as Andrew said, there are thousands of providers, hundreds of commissioning bodies, but if they all work together properly, then the world will be a better place. That is, of course, true, but I think in the end, it's how you do that is actually the key to making practical improvements. And of course, underlying all of it always is, how do you pay for it? How much do you need to pay? And who is going to be doing the paying? Those are the crunchy issues that have meant that for many years now, politicians have got as far as the fence of trying to jump the sort of hurdle of radical change and have shied away from it. Because if you confront the general public with the thought, actually, if you look at it sensibly, we need to be spending, I mean, figures differ, 8-10 billion a year more on social care. That's very significant amounts of money. And I hear what Andrew says about, well, we'll just gradually increase the money over a number of years. He's exactly right to say that. But the political reality is that any government has competing demands on it, and it is never obvious that social care is going to win the battle to be near the front of the queue for having those competing demands met. So I, rather than having an all-embracing solution, want simply to point to 4 areas where I think we need urgent improvement, some of which overlap with what Andrew said. So let me go through them. First is the workforce. Clearly, we need more workers. We need not only to recruit more workers, we need to be better at retaining them. And that needs 2 things. First of all, it needs a proper understood career structure so that you can go in and expect to work your way up the system the way you would in any private sector job or indeed any public sector job. It's slightly odd that we talk of care workers as though they are permanently people who subsist on whatever the minimum wage is at that time or a bit more, and that's all that we need. That's, of course, not true. And to be fair to the current government, they have made some steps into introducing better workforce planning and career planning. But again, we have to do more. And one of the areas where I agreed with what Andrew said is that pay, the other half of it, must be better pay. And in particular, it seems to me that the ambition should be that people doing the equivalent jobs as people working in the NHS under the Agenda for Change grades should be on the same pay. Otherwise, you will find people, they will know perfectly well that they are doing a job for an amount of money in, say, a care home, and they could do substantially the same job inside the NHS for substantially more money. It's a no-brainer that a lot of them will move over to the NHS. So I think sorting out the pay issue is clearly key for long-term stability of the workforce. The other two of the other points I would make, one is on housing. We don't have anything like enough housing that enable people to live in their own homes, which the vast majority want to do for as long as possible, which is both better for them, it's what they want to do, and it's a lot of evidence that it's better for them, but also is significantly cheaper. So as all of you who are running social care departments will know, that however expensive domiciliary care is, it's a lot cheaper than residential care, whether the individual is paying for it or whether by some means or another the taxpayer is paying for it. So I think that building and converting more housing so that we can make sure that people can live in their houses for longer is an absolutely key practical change we should make. The third point I would make is about technology, where not cutting edge technology, but technology that is readily available now could be used much more than it is to make sure, again, that people can stay in their own homes and have a decent quality of life for longer, whether it's technology that will remind them at regular intervals to take their pills or warn their family that the fridge hasn't been opened over lunchtime, so therefore something has gone wrong. Perhaps somebody elderly and confused has forgotten to have lunch. All that kind of thing is perfectly available from technology, even before we move into the realms of AI. And I think we've only scratched the surface of using that. And oddly enough, one of the arguments for greater local control than a national care service would imply is that I'm sure there will be good ideas all over the country in various schemes that would enable this to happen, and others could pick up on best practice. But the final point on the 4 points I want to make is about funding, because of course we can't get away from that. And I think the most radical change I'd like to see, which would affect you, is that we should stop relying on council tax for the bulk of the funding for social care, simply because if we carry on doing that, then the number of other services councils will be able to provide will be inevitably squeezed, and in the end, local government will become a social care service with one or two other things added to it. And that's not what people expect from their local government, and it's not what all those of you leading local government want to be doing. So, well, as I say, as you hear, I'm sceptical about the idea of badging something a national care service. I do think that national taxation plus private funding from those who can afford it needs to be the basis of how it's funded, though I absolutely get the point that it needs to be run and controlled at a more local level than through a national service. There are many ways you can get different amounts of money in. I'm still attracted to the idea I floated years ago for an insurance system that people could pay either through their lives or with a lump sum from something like the value of their house. You know, a small sliver of the value of the free equity and housing of the over 65s would mean that everyone could insure themselves against catastrophic care costs. And I still think that that is a useful line for somebody to pursue, even though I fully accept that nobody is going to pursue it very hard in the months leading up to a general election. So, as you all know, we need radical change. We need a sustainable system. The current system is not financially sustainable. And until we get to that, then this will be a permanent quiet crisis in our public services, and I would hope we can all get beyond that and see some sunlit up plans in the future. Thank you very much.
Thank you, Damien. So Nandra, you've now heard from Andrew and Damien, and from your perspective?
Thank you. Yeah, I mean, I think this is quite challenging for me to do in a few minutes, to be honest. Just listening to some of it, and I'm doing this from the service user perspective as well as the provider angle on all of this. I mean, it's the most thing that's welcome for me is that there is a plan. If we have a plan, that would really work for me, and really, I'd welcome that. But what I think is when you look at a plan, and you had that slide up, Andrew, about that sort of, see where we are and then evolve. I think for me, there is also look at what works well and invest in it, because I'd hate to think that we throw out the baby with the bathwater. We've done that too many times. We end up in a really, really bad place. And what doesn't work well, and then how do we fix it? That's about the evolutionary bit for me, because if you think about the individual and you think about the provider, we really need a bit of realism into this, which is the key. We continue to overpromise and underdeliver. And I really like the idea of a standalone social care sector. I'm really fed up to the back teeth about consistently being compared with the NHS. It's a consistent messaging that comes out, and it was really good to hear Helen Whately this morning talking about that as well, because I think until and unless we have a separate department, we don't have a Department of Health and Social Care, we have a Department of Health only. And I think that really worries me. I think the other bit in the plan that worries me, I mean, you said quite clearly, it's not a threat to local government or the NHS. And the questions going through my head, I was listening to that, was what about devolution? What about regionalisation? What about localism? Because we've had on this stage today, some of the sessions I've attended, that things work differently. I think it was the Labour perspective, talked about some areas where things work really well and other areas where they don't. And generally speaking, things work well when the local authority works with partners, and those partners have to include the sector. If you don't include the sector, who's the delivery arm, then there's always going to be a challenge. And I think, sadly, that hasn't been mentioned very much. Not that I'm that surprised, but I mean, I'm here. It could have been mentioned a little bit more. I think we've got to think about the reality of where we sit. And as people talk about the National Care Service, which I'm not a fan of because I don't understand what it actually means. If I speak to 7 different people, they'll give me 7 different versions of what they think the National Care Service might look like. But I'd like to know, that we're working towards something. But if you look at it, Mrs. Jones is heavily reliant on her care to be delivered by a number of different services. That will include the local authority potentially, the NHS, ICSs and community services. These are 4 partners who deliver those services, and we've got to bring all of that together. And I think that for me, really, it kind of, how is that relationship going to work under this new, the care service? I think the image of social care, I'll just touch on. I think it is very poor, and I think the workforce issues, I could go into that for a very, very long time. Sustainable finance, you can't do any of this unless you put some money against some of it. You can't. It's great to have a plan, but actually let's be realistic about where we're going to be, how we're going to deliver it. And I love evolution. I do. I think it's great. But start with that investment package as to where we're going to go. And involve the sector, because the sector has sustained this service. When you think about it, if a local authority is paying £700 a week, it's about £4 something an hour for a service that is now quite critical to somebody. And I think that, you know, the reality of where we are is really uncomfortable. It's really uncomfortable. And our workforce deserves much better because they do a job that is invaluable, and you sustainably call them underskilled. And I'm fed up with it to that teeth, because they are the people who are making the difference in the individual's life. And they should be paid much more. I mean, there's a leak today in the Telegraph about the international recruits. Why do we need international recruits? We need them because the domestic workforce is not willing to work in a sector that is so slated, has a poor image, and there's no mention of qualifications. I'll stop there. Sorry.
Thank you for that, Nadra. We do have a few minutes left for questions. If you could say where you're from and your name, I can see Izzy jumping up and down in the seat. Izzy. I think there's a microphone coming down, is there? Down here? I know. You do have a loud voice.
Izzy Second, Warwickshire. So, yeah, I have a problem with the National Care Service, largely because none of it in that presentation that you talked about the wider interests of the council and how it delivers a prevention agenda. And it's community services in a different way from the ones that we're talking about. How we, in our local government world, build community support networks that actually help to keep people independent in their own homes with a network of support, which is something that you've talked about. And I really value what you said. I think it was so helpful. You know, this isn't the back of a fag packet. This is actually about reality of people leading lives. And I think what we haven't done is talk about what people want and how we're making a difference. And it's not going to be the same in one place to another. It's not going to be the same in one community, you know, in an urban setting to a rural setting, a city setting to a small village community. You know, we aren't all the same, homogenous. We need to value the independence that local government can bring. And I just hark back to the things that I have said for far too long, because there have been more reports than I've had hot dinners that have gone nowhere. But, you know, this, for me, is actually about the people, it's about the workforce, it's about passion, and it's about community. And it's not about, you know, someone in a Whitehall setting that's going to design something that actually doesn't add any of those into it.
Thank you for that, Izzy. I'm going to come back. There's one more. We've got David. Is there anybody on that side that wanted to? And then there's a gentleman at the back as well there.
Thank you. David Fothergill from Somerset, and I have to declare that I was in one of your focus groups that where this was discussed. I think my views...
And if we could get straight to the questions as well, please, because we've only got about 3 minutes left.
Okay. So, do you actually think you've bottled it? Because if you believe in a national care service, which is where I think you are at, why would you not just go for a national care service, or are you just trying to temper it so we stay on side long enough so it becomes policy?
Okay, and if I take, there was somebody there, if I use the last one, and then we'll quickly go around the panel.
Thank you. Lisa Spivey from Gloucestershire County Council. I'm just interested, Damien, in your report, which is coming next year. I note that we had, you know, new governments in 2010, 2015, 2017 and 2019. At what point are we actually going to take this seriously and see some action?
Nadra, shall I come to you first? Do you want to make any comments? And then I'll go to Damien and then end up with...
Well, I think the question is to Damien.
It is,
Damien?
yes.
Damien, if I come to you.
Okay, I mean, answering Lisa, whatever happens at the next election, if we're going to have action, it's got to come soon after the election. It's not going to come in the second half of a parliament. It's got to come in the first half of a parliament. I think that's the lesson of not just the last 10 years, of the last 20 years. And can I just say, before I hand back, that I completely agree with Izzy's point that actually having a whole system approach to the individual, so that and prevention being better than cure, largely, is absolutely the way we should be going, not just in social care, but in wider health policy.
So I think Izzy and David have attacked me from two different directions. That Izzy wants, you've just very articulately put out the localist vision of like bringing together services in a community. They should be different everywhere. And you told me I haven't created a national enough service, or not. And we looked at the evidence and we talked to an awful lot of people about what was right for adult social care, and not trying to take a model from somewhere else. And our conclusion was that all the great stuff councils do, creating services with communities, with service users, and weaving together lots of different local services, was very, very important for social care. But also that something had to change. And I think this is what I want to leave you with. You may not like the phrase National Care Service, but I've worked in and around social care for 20 years. We have just been around that circle so many times of calling for change and nothing happening. My view is the reason for that is a lack of national leadership and accountability. It's never been the Westminster Whitehall politicians who have ultimately faced the ballot box and been held to account for the failure of social care. And the something needing to change is the national link, so that it is the duty of the Secretary of State to deliver good care outcomes for citizens, working through local government, supporting you, making you able to do the job you want to do, which at the moment you're just not able to. You are being failed and let down by our political system and by the machinery of government, the fact you do not have enough money to do the things that the Care Act tells you you should do. And the only way we will crack that is if national politics changes. And we think that a big, bold, new brand for social care and a new set of responsibilities for the Secretary of State is the way to do that.
Thank you very much. Can we show our appreciation to the speakers? No doubt you'll speak after. Thank you very much.
Right, conference. Oh, that's a bit loud, isn't it? Draw your attention, though. I'm Stephen Giles Medhurst. I'm the CCN Transport spokesperson on transport. We have remotely Helen Morgan, who will come on screen hopefully in a minute. A brief introduction. We do have a hard stop at 4 o'clock as Helen has parliamentary commitments. Now, Helen has been the MP for North Shropshire for just under 2 years, elected in December 2021, and she has been the Liberal Democrat spokesperson for Levelling Up Housing and Communities since July of 22. Now, Helen actually has some background in local authority in terms of she has been a parish councillor and was narrowly unsuccessful by 23 votes for Shropshire Council in 2021, but got obviously a rather more important role in terms of the MP for North Shropshire in later 21. Now, previously, Helen has been a chartered accountant, and prior to that has worked as a financial controller for a real estate business in North Shropshire, and her previous experience also included being head of margin forecasting at British Gas and financial reporting at Centrica and audit manager at KPMG. So I welcome Helen. Helen's here to speak about the Liberal Democrat view for local government. Over to you, Helen, and hopefully we'll have time for a few questions at the end.
Well, thank you very much. I hope you can all hear me well. It's never easy when you're online, and apologies for not being there in person. Thank you for asking me to come along and give the Lib Dem perspective. I suspect, given some of the challenges that county councils and unitary authorities face, you will have heard some quite similar perspectives and speeches today. But here we go. I will give you an idea of what we see as the key challenges facing local authorities and how we would go about addressing them. So it won't come as a surprise to anyone to hear that we see funding as the most critical challenge. Not just overall levels of funding, but also differential levels of funding. Different authorities have different council tax bases, so their ability to raise extra revenue by putting their council tax up by 1 or 2% every year is very different. So councils in Surrey can raise millions of pounds from an extra 1% increase in council tax, whereas back in some of the more rural parts of Britain, that doesn't have quite the same impact. And more importantly, the cost of delivering services in different parts of the country is very variable. So where I am in Shropshire, the cost of delivering challenge services like social care is extremely high because of the sparsely spread out conditions that we have to deal with. Whereas perhaps in some more urban areas, although the level of need may be greater, the cost of delivery might be more efficient. So one of the things we're looking at is to how those disparities between different councils can be addressed and how the funding formula might be addressed to fund those councils more fairly going forward. But I think it's important to acknowledge that just splicing the pot in a different direction won't address the overall pressures that councils face. So there is need to raise additional revenue for councils. Now, Liberal Democrats are passionate believers in proper devolution, but we don't just believe in devolving power, we believe in devolving the funding to exercise that power as well. So we would like to see an overall reform, really, of local taxation and how it's raised, not least because council tax has become quite regressive in nature. And there's, as I mentioned before, this big disparity into how much you can raise between different areas. I just probably also want to touch on sort of future challenges. We know that rural areas tend to have an older population, that the older population is growing everywhere, but it's growing faster in rural and coastal places. And there was an excellent commentary on this by Chris Whitty in his report last week, that we need a better plan to deal with that challenge of an older population in rural and coastal places and the additional care and additional services that they will require when we have a shrinking proportion of working age people. So I think that's definitely on the agenda for Liberal Democrats as to how we can fund those people more fairly and effectively. So what would that look like? Well, reforming council tax could be a starting point. We'd certainly want to see some additional higher bands put in so that people living in the most valuable properties could pay a little bit more. But we also want to look at the whole principle of funding local government and look at the possibility of local government raising its own tax locally in order to be able to fund the services that it needs to provide, because that would just be a much sort of fairer way of doing it. We're particularly concerned about second homes and empty homes because of the housing crisis. And although I know we don't have any district councils here, I will touch on that briefly towards the end. And we would definitely want to levy additional charges on empty homes because they are hollowing out communities and making it harder for councils to deliver their services. But just diving into the specifics a little bit more, obviously social care and children's care are the biggest problems that are faced by county councils and unitary councils. And in some rural areas, Shropshire in particular, there's an enormously high proportion of budget spent on those problems. So the much mooted number in Shropshire is 85% of Shropshire's council's budget is spent on social care. It's increasingly difficult to retain carers and recruit carers into the industry. So those costs are increasing all the time as private providers struggle to fill out packages. And in addition, that means that 97% of residents are paying more council tax for services that have been shrunk in other areas because the level of savings needed to be found is so great. So that's a real issue. It's a problem to do with the generational contract, as well as just keeping people in the dignity that they deserve to be kept in. So reforming social care, I think, is the key to all of the challenges that councils face in that area. One of the suggestions that we've made is to increase and fund from central government the minimum wage for carers, so that it's easier to recruit those people and to have those social care packages operating in an effective way. And we'd also like to see social care professionalised and overseen and accredited by central government, so that the standards in those areas are rising and it becomes a more attractive profession for carers to work in. We also need to acknowledge the very, very important role that unpaid carers play. A lot of councils would really struggle if a high proportion of their unpaid carers walked away from the services that they provide. So we would like to see better package of support for unpaid carers. And that helps people stay independent for longer and ultimately is a cost-effective thing to do as well. Moving on slightly, just because I'm conscious of time, from social care into SEN, I think everybody's aware of the increasing cost of SEN and EHC plans. I think those numbers have been rising around 10% every year. And when I recently had dinner with a number of Liberal Democrat councillors, they said that they found that one of the biggest challenges, that they hadn't become councillors to say no to people, but they were increasingly having to cut services and find ways of saying no because they simply couldn't afford the burden that SEN is placing on them. So obviously there's a legal requirement to issue an assessment for an EHC and support those needs that have been identified by the EHC when it is finally assessed. But thousands of people are not getting those in time. There are thousands of people taking councils to court to get what they need from those EHC plans, and it's starting to threaten council sustainability. So we think, and I know we're always talking about lots of extra money, but I think it's a false economy to deny councils that money, that we need to give local authorities extra funding to halve the amount that schools pay towards the cost of a child's additional SEN support, from 6,000 to 3,000. So to remove the financial disincentive that stops schools from identifying those SEN needs, and also have a national body for SEN that will fund support for children with the most complex needs. So paying costs over and above £25,000, so that those needs are identified and dealt with rather than sort of minimised in relation to a council budget. And then finally, just wanted to leave some time for questions. Unitary authorities obviously have an issue with housing. We've talked a lot about the housing crisis and the fact that thousands more families are becoming homeless and being required to find temporary accommodation. And for unitary authorities, that is starting to blow up in an unexpectedly rapid and large way. And so we believe that district councils and unitary authorities, where appropriate, should be given the money to build social housing to take that burden away from them. We're spending about £10 billion a year in housing benefit that goes to private landlords. So there's a lot of money leaking out of the system that could be used to house people from within the system. And we really want to see those numbers of people living in temporary accommodation come right back down, because no family should be living without a safe and secure home over their head. So we build 150,000 new social homes a year across the whole country. We help those local authorities to find those targets locally, so that they built up to the 150,000 that we'd set nationally, and they would be binding, but they would be funded. So we would try to ease that crisis in temporary housing cost by addressing the root cause, which probably isn't in the private rented market, but it is in the total paucity of social housing across the country. So that's a bit of a whistle-stop tour. I hope that gives you a flavour of where we're coming from, and I'm happy to take any questions as we canter through.
Thank you, Helen. Thank you very much for that. Questions to Helen? Thank you.
Thank you. Richard Bell, Durham County Council. Interesting and encouraging to hear you talking about formula review and fairer funding, which seems to have slipped into the too difficult box currently. I just wanted to raise the issue of houses of multiple occupation, HMOs, and particularly for those of us with large student populations, that they pay neither council tax nor business rates. They do put significant demands on council services. You just have to look at the amount of rubbish that gets generated. And yet there's no charge coming to the councils for that. The argument against is that, well, it would just get passed on by the landlords to the students, but everybody else has to pay for council services. Why not HMOs?
Yeah, I think that's an interesting question, actually. It's not something that I have a lot of direct experience of, because we don't have a large student population in Shropshire. But I think that is an interesting question. It would be nice to see landlords picking up the cost for those HMOs, because obviously they're the ones making the money out of it. But I appreciate your point that it could be handed on in terms of rent. The Renters Reform Bill that's going through at the moment should be trying to find a more flexible way for students to be accommodated, but to be given a little bit more power vis-a-vis their landlord. And it's certainly something that I think we should explore then. But I'm overall sympathetic to the landlord being responsible for the services that are provided to those houses.
One more question, have we got one from the floor? In which case, probably, Helen, you got off lightly for your 4 o'clock appointment. Thank you very much, and have a round of applause for Helen, please.
Thank you.
Right, good afternoon, everybody, and we are now nearly on the home run. So we've got Sean here, who I'll introduce, and then we are expecting the Secretary of State at about 5 to 5 or 5 o'clock. It keeps shifting, But anyway, I'm sure we'll be ready for him when he's here. But in the meantime, can I welcome Sean Davis, who most of you will know anyway. Sean is the recently elected leader of chairman of the LGA as of July this year. And of course, the LGA is now politically controlled by the Labour Party. Sean has been a councillor for some 12 years at Telford and Wrekin, because that's a baby compared with most of you, actually. But also has, in fairness, been the leader of the council for the last 7 years, which is a bit more serious, and is the prospective parliamentary candidate for Telford and Wrekin. So, and has made an excellent start at the LGA in what has been slightly difficult times over the last few months. I'm hoping that we'll get something from Sean in terms of perhaps a little bit about the white paper, or at least the process. The LGA are producing a white paper for their next government, so we'll see what sort of things that might include. And then really kind of, I suppose, from a CCN perspective, how do we make that relationship work even better between the LGA and the CCN? So anyway, Sean is going to chat us through a few things, and we'll leave it to you. Thank you very much.
Thank you, Tim. I don't know what's more scary, being between you and the Secretary of State, or between you and dinner. So I'm glad that the Secretary of State will be between you and dinner. In fact, I saw the Secretary of State this morning as I got onto the train at Stafford. He was coming off a train into a car as I was getting onto the train. I thought to myself, maybe we're going to the same event. And it turns out we are going to the same event. But I got here on time, and he's slightly late. And there is something about making sure that you follow local government rather than following central government. That's a lesson for us all there. It's brilliant to be here with you all today. And for those who don't know me, as Tim said, my name's Sean Davis, and I'm the council leader in Telford and Wrekin in Shropshire, and have been the chair of the Local Government Association since July. And before that, I was the leader of the LGA Labour Group. And local government is in my DNA. I think that the work that we do as a sector is vitally important to our communities, our economies, and our places. And I'm also delighted to see so many friends in the audience, particularly the Conservative group leader of the Local Government Association, and my friend, Kevin Bentley, the Senior Vice Chair. And it is a real honour to be the chair of the LGA, the voice of local government. I also want to pay tribute to Councillor Tim Oliver. Tim, congratulations on your LGIU award just recently. It's fantastic to see the dedication that you've made to Surrey, but also to the sector across the country recognised at those awards. Congratulations, Tim. We work hand in glove with central government, and we do so because we want the best for our communities. The CCN and the members of the CCN represent around 26 million people across our country. And the county council network and county councils are a fundamental fabric of our country. And often we talk about local government as being a family, and it is a family. And that family is made up of DCN, CCN, London Council, Sagoma, and many, many others. But what is really important, just like a family, is ensuring that we have a single voice to government, working alongside government, but also challenging governments to go further and faster. It's important that councils are respected. It's important that councils are valued. And it's important that the relationship between the centre and local is equal. I've often said that there is no special lever in Whitehall which any minister of any political persuasion can pull to make their priorities a reality. If you want to get this country building again, you have to have the support and the impetus from local government. If you want a national growth strategy, you need to have a local growth strategy. And if you want to have a transformational NHS, then you need a strong social care system delivered by local government. Local government is really important to our country's well-being. But we know, those in this room, that things have been very, very tough. And indeed, as the CCN recently said, 1 in 10 councils now face the prospect of being effectively bankrupt. And that number will rise as our demands on our services increase and our resources and the ability for our resources to grow are limited. My biggest frustration, however, is that often the services that we deliver, if reformed, are preventable. They prevent demand on the NHS. They prevent demand on our education system. They prevent demand on our police, our prison and our justice system. But often, those preventable services are not being recognised or valued in the way that I think, and I think most of you will think, is important. But we can't, as a sector, continue to only speak about money. We also need to make a grand offer to all major political parties ahead of a general election that says if you invest in local government, if you support local government, if you trust and respect us, then we will, and give us the tools that we need, we will get on and deliver for our country. And that means a new central-local relationship. A central relationship by ministers, and may I say, civil servants, that trust local leaders in local places across the country. And as we look ahead to the autumn statement on Wednesday, the challenge to central government is stark. We estimate together as a sector that there is a £4 billion gap over the next 2 years. And that £4 billion gap is not a gap over projected spend, but the £4 billion gap just to stay still as a sector. Now, that is the equivalent to councils stopping all spending on waste collections, library services, and recreation and sports combined. The areas that are particularly under distress, as you will know from your own councils, is adult social care, children's services, and housing and homelessness. And as I say in my opening remarks, those 3 areas are the areas that we as a sector can not only provide better outcomes for our residents and our communities, but save the government funding and money. On adult social care, there remains huge issues. And the Health Foundation suggested that to meet future demand and improve access to care and covering the full cost of care will come with a potential price tag of £8.4 billion by 2025. As of March 2023, over 430,000 people were waiting for a care assessment, a care review, or support for a direct payment to start. And that includes 82,000 people who've been waiting more than 6 months. That's a 30% increase on the previous year alone. You can't fix the NHS without fixing social care, and you can't fix social care without fixing local government. And children's services, something close to my heart as an individual, as a council leader, and as a citizen of this country. There's been an increase of £1.5 billion this year on planned investment in children's services. That's a 13% increase across the country alone. But the cost pressures are driven by continuous growth from those children that need care, up 82,000 since 2009. But also we're seeing in our communities the increase and the complex nature of those cases growing at a time when the market that seeks to provide services to the most vulnerable in our country is fragmented at best and broken at worst. Spending on fostering and residential placements has increased by 40% between 2016 and 2022. And the independent review of children's social care found an investment of £2.6 billion over 4 years was needed to reform children's social care and rebalance spending towards early help. And we know that by investing in early help saves money down the line. The LGA is therefore calling that the government should meet the existing cost pressures to stabilise the children's social care system, and this would then support councils to reinvest in early help and reduce the demand for more expensive cost interventions further down the line. And on homelessness and housing, we have a bizarre issue where government, through the Home Office, is spending £8 million a day on putting those who are waiting for their asylum claims to be checked, whilst at the same time, councils rightly raising concerns that as those assessments are checked and completed, it will be councils that have to pick up the demand from government through the increase in applications for homelessness. And again, I want to congratulate and celebrate the fact that Robert Jenrick, the Immigration Minister, called us in to his department to ask for our help and support. There's no party political, there's no local government versus central government difference on helping those who are in those hotels. They need to have their asylum applications determined. If they should legitimately be here in this country and they should access housing support, then we as local government are proud to support those who come to this country fleeing persecution. But equally, if those people who should not be in this country, they should be deported and removed quickly. But in both scenarios, at the moment, it is local government picking up the tab for a failed system. Spending on homelessness services is budgeted to increase by almost 20% this financial year, and the government's data published in July shows that more than 104,000 households were in temporary accommodation at the end of March 2023, the highest figure since records began. There was almost 1.2 million households on the council waiting lists, and the cost of councils was at least £1.6 billion on temporary accommodation. If we were able to convert that £1.6 billion from temporary accommodation, we could build tens of thousands of new homes up and down the country. We're also, together as a sector, working to lobby government to increase the local housing allowance, which supports those who claim housing benefit, often in work, to be able to reduce their payments. So the challenge is difficult, the challenge is great, but local government is up for that challenge. We have recently launched a white paper, a local government white paper, by local government, for local government and for communities. And the aim of that white paper is cross-party, cross-sector, is to say to the government, these are the things that we need from you, and these are the things you can expect from us. That means interventions around local work, that means interventions around homelessness and housing, but it also means that there are certain changes that the government can make which does not necessarily cost the government any further funding, but will be reforms that matter to local government. For example, one of the submissions that I've read just recently is about reforms to social worker practice. It can't make sense, in my opinion, for a social worker to be trained by councils up and down this country, only then to move to agencies, costing councils thousands of pounds more a year, and also making agencies millions of pounds in profit. And this consultation submission is the type of thing we're looking for, where we can say to the government, if you were just to prevent social workers moving from the local government sector into private agencies by saying for the first 5 years you're not able to without some type of recompense back to the local government, that would make a real difference without costing a penny to central government. It also doesn't make sense for the restrictions that we have placed upon us as local leaders. For example, the cost of planning applications. Why is it that councils are subsidising private interests to fund their planning applications? There's been a lot of progress made on this, but far more to do. And also, why is it that local government are capped by how much a fixed penalty notice for fly tipping you can impose on those people who drop litter, or without the ability to recover the cost of the investigation, yet alone the prosecution? So these are the type of offers that we want to make to the government, on the basis that working alongside one another, we can make our country a better place. And just finally, I think it's important that at a time of potential change, we remember something that I was told in the first year as being a council leader by somebody in this room, actually. I won't name who it is. But there is no party political differences within local government, not real ones. There's two parties in this country. There's local government and there's central government. And local government must continue to work together to support ourselves as a sector, but also the communities that represent us, elect us to represent them. And always remember that there is no special lever in Whitehall. Anybody who claims that there is wrong. And central government needs local government just as much as they need us. And just like as I opened the remarks with the taxi story with Michael Gove at Stafford's train station, always make sure that central government is following us, not us following them. Thank you.
So I think we've hopefully got time for 2 or 3 questions. Before I do that, though, can I just remind you or tell you, those who weren't here last night, that we are capturing the carbon footprint of this conference. So Zella, who are organising that, you'll have seen their banners around. Can I just think, you should have had a push notification to your emails, but otherwise just go up to the banner and just open up the QR code. But if you could, we don't want Michael Gove actually putting in his trip from wherever he's come from, by the way. But if you could just please do that would be really helpful. Right, okay, who would like to kick off then with a question to Sean? Kevin? Yeah.
Kevin Bentley, leader of Essex County Council. Just remind me again how excellent the senior vice chairman is at the county council. Sorry. Sean, look, very good, and it's absolutely right that we don't govern for the government, we govern alongside the government. And it's worth just knowing a bit more about what we do continuing in the LGA and with CCN and DCN to make sure that voice gets across, because the one thing we're very good at talking about all the time are people we represent. And my view has always been each policy, each decision we take starts with people, and you work back to see if the policy works, not start with the policy and then trying to make it fit people. Just explain a bit more about what we do at the LGA and with CCN and DCN to make that work.
Thanks, Kevin. I'll decline the invitation to provide more praise to the Senior Vice Chair of the LGA on the basis that you might start to believe that praise. I think you're absolutely right, Kevin, in terms of that work that we do as a sector to lobby government, to campaign with our sector against the government and also civil servants. And I think the ability to make an offer, a credible offer of change, which goes to support our people, the people that elect us, whether we're councillors or whether we're members of Parliament or ministers, is really, really important. And after all, most residents, most people that you speak to in this country don't live their lives by whether it's a local government decision or a national government decision or whether it's a neighbouring authority's decision. They live their lives through the basis of what affects them, what's important to them. And I think it's really, really important that we continue to make that case, always be people-centric in the decisions that we make. I think for me, money is, of course, important, and I would be on this stage without credibility if I didn't talk about money to a local government sector, but also the potential that we have as a country, the potential that we could deliver together is really, really important. And I think the other thing to say is that the offer that we can make to the government is equally as important. And as I said earlier on, if you look at the Prime Minister Minister's priorities, if you look at the Leader of the Opposition's priorities, the national priorities that have been set, each and every one of them links back in one way or another to local government, and the ability for us to be empowered, for us to be respected, for us to be resourced is so, so important.
Excellent. So Michael has joined us, arrived now. So Sean, thank you very much. Sean will be staying for dinner, actually, so do catch him later on, and if there's anything else you want to catch up with him. But thank you very much. Slight change of plan there, so it's probably going to be easier to do it from the lectern. So can I welcome the Secretary of State for Levelling Up Housing and Communities, as well as the Minister for Intergovernmental Relations, which I think is Scotland. Michael is, as you know, the Member of Parliament for Surrey Heath. That's Surrey Heath in the county of Surrey, and as the makers of Carlsberg would say, probably the best county in the world. Michael has held many, many different cabinet roles since 2010, and almost been continuously in the cabinet and under 4 prime ministers. In fact, I think the only person I know that's held more titles than Michael is Kevin Bentley. Yeah. But most importantly, Michael has been and is a fantastic advocate for local government. You know, he really understands our challenges and indeed the opportunities. So I'm very much looking forward to hearing from Michael in terms of what we can expect over the next few months in the run-up to the election, and indeed anything else that you feel like covering. So, and Michael's very kindly agreed to do a Q&A at the end. So, Michael, thank you very much.
Tim, colleagues, thank you. And Tim is, I think, almost right. I don't know if Surrey is definitely the best county in England, but I know it has the best county council leader in England. Not just my words. The LGRU recently anointed Tim as Leader of the Year, and I know from seeing Tim campaign on the ground to seeing him corral the diverse range of personalities that make up the Conservative group on Surrey County Council, to lobbying discreetly and effectively in the corridors of power, that Tim sets the gold standard. There are rivals for his crown, but Tim, you are a hugely effective voice, not just for Surrey, but for county and unitary authorities, and indeed for local government, and I'm hugely grateful to you for the leadership that you continue to show. It's timely, in a way, that I'm here, because as we all know, the autumn statement comes on Wednesday. Now, I feel, in a way, a bit like a parent. I know some of what is under the Christmas tree. I know the shape of some of the parcels. But I'm not allowed to rip the wrapping off before the big day comes. So you'll have to forgive me for being a little bit more reticent than I would ordinarily want to be. But one thing that I can tell you is that in advance of the autumn statement, I've been doing my best to reinforce to the Treasury and to Number 10 some of the particular challenges that local government faces. And I try in speaking to the Treasury and to Number 10 to strike a balance. I make the point, as Sean just did, that many of the challenges that we face as a country, many of the opportunities that we wish to exploit, will not be possible without the active support and assistance of the brilliant people that we have in local government across all parties and including independents. If we're going to build the homes that this country needs, if we're going to see the wider infrastructure delivered, including on energy and transport, if we're going to make sure that our children achieve in education, if we're going to make sure that our National Health Service works as effectively as possible, if we're going to deliver the economic growth that will underpin our future, if we're going to level up and to make sure that economic opportunity is spread more widely, then local government is the indispensable partner. And it goes without saying as well that even on issues which one would think of as global, like the battle against climate change and the drive to net zero, then local government's voice, muscle, persuasive power is integral to what we do. So I'm not just an advocate for local government, I'm an optimist for local government as well. However, no one doing my job, no one reflecting what I hear from local government can be anything other than also aware that local government is facing particular challenges at the moment. And I'm aware that the shoe pinches tightest in many respects for counties and for unitaries. That's not for a moment to take anything away from the pressures that boroughs and districts face. But let's be clear, if we look at some of the big challenges that local government has in financial terms, then they exist in the authorities that you lead. Firstly, of course, the problem of adult social care. I know that my colleague Helen Whately joined you earlier, and I know that Helen, in her speech, was able to say not just a little bit about social care, but also to be a walking demonstration of how helpful the National Health Service has been to her in her hour of need. But the points that Helen made are points that don't need labouring in your minds. When it comes to the effective operation of social care, then the resources that have been allocated in the last year have certainly helped, but they have not defrayed fully the pressures that we all face. We're going into a tough winter. The NHS has suffered as a result of the COVID pandemic. People within the NHS, never mind the industrial action, which we'll put to one side for the moment, are operating under strain and high pressure. I know that sometimes the decisions and edicts that individual NHS managers and executives make can sometimes seem high-handed and insensitive to those of you in local government who are working hard to ensure the effective delivery of social care. But what we all need to do is to make sure that the resources are allocated appropriately, and we also need to make sure that some of the work, including the work that Newton has done in collaboration with the CCN, is hardwired into our delivery. We know that there are critical points in the handover, in the juncture, when patients are being discharged from hospital into social care, when the NHS doesn't necessarily have all its ducks in a row, and there are frustrations for you in local government as the professionals whom you pay for, marshal, lead and inspire, are occasionally frustrated that their role is sometimes seen as a Cinderella or second-class role to those within the NHS. Helen gets it, our new Health Secretary, Victoria Atkins, gets it, but ultimately, a change of attitude and a change of delivery needs to be accompanied by appropriate funding, and that is one of the key cases that I've made. But if the challenges in adult social care are still significant, I think most of us here would agree the challenges are even more significant when it comes to children's social care, support for children with special educational needs, and also the particular challenge of home-to-school transport for children with SEN. Now, the number of children who are presenting in our schools with special educational needs, the number of children also, actually, who need access to support from CAMS because of mental health challenges, has only been growing. Now, some of that pressure is as a result of welcome advances in medical science that allow children who generations ago might not have been with us to lead full and flourishing lives. But those full and flourishing lives depend on resources being available in school and elsewhere. But it's also the case that the COVID pandemic and the fact that there were so many children who were out of school, particularly younger children who perhaps were not socialized in the way they might otherwise have been, have meant that those children are arriving in primary school, and I hear it in my own constituency and I hear it from you, without necessarily being fully socialized, without necessarily having all of the skills required to enjoy school fully, and in many cases the difficulties that they have are exacerbated or have been exacerbated by other challenges as well. The impact? Well, the impact on schools is that teachers are still doing a brilliant job, but extra provision is often required. And it's also the case that parents, knowing that some of what may be required can only be secured through an education, health and care plan, or so they believe, and they're right in many cases, are fighting hard in order to secure the very best provision for their children. Who wouldn't? We all would. But that means that the pressure on you is all the greater. And it means the capacity to effectively triage resources, to work out which are, and it's such a difficult choice, which are the most deserving, rather than simply those with the loudest voices, or the deepest pockets, or the most persistent lawyers. That difficulty is one I understand and feel. Allied to that, and I mentioned home to school transport, is the fact that the current provisions, which date back some time, do need to be revisited. And one of the things that I know Gillian Keegan and David Johnston understand is that as well as resource, we also need reform in this area. Reform that ensures that we are better targeting the resources that we do have and the extra resources that I hope that we will secure in order to ensure that we can provide a more flexible and more effective service. Our own local authority, Surrey, has had a particularly high incidence for a variety of reasons of children presenting with special educational needs. And I know that Claire Curran, the lead member for Children's Services there, has prioritised additional resource in order to make sure that cases are dealt with more quickly, that parents are not left in limbo, and that children can get the support that they require. But even in our relatively wealthy area, with a very well-managed leadership team, the pressures are real, and I'm all too well aware of them. So the arguments, forgive me, the cases that I make with other government colleagues are predicated on the basis that local government can deliver, local government is ready to reform, but local government also needs the resource to be able to make that reform work effectively. And in talking about the financial pressures that local government faces, of course we're talking against a backdrop where a number of local authorities have had to issue notices, have had to essentially announce that their financial management, or acknowledge that their financial management has led to their councils into or onto the brink of effective bankruptcy. Now, I know that that warning light, those notices, should only ever be used sparingly. And I know that in those cases where intervention has been required in local authorities so far, in Birmingham, in Slough, in Thurrock, and in Woking, there have been systemic managerial failures, often going back many years. But I also know that there are other local authorities, well-run and well-managed, that are looking at the next few years, drawing down reserves, thinking about the delivery of non-statutory services, and being forced in some cases to make very difficult decisions. Again, my view is we need to make sure that there is an approach towards funding local government that appreciates those strains, but also an approach towards local government that champions what is going well and anticipates where problems are and allows for intervention earlier. The LGA does a great job in helping to identify problems and providing peer challenge. But my view is, I think everyone here knows, is that we need an extra level of assurance, of accountability, and of assistance. And that is why OFLOG, the Office for Local Government, has been established. And no, it's not the Audit Commission come back from the grave. It is not an attempt by central government to award prizes to you on the basis of how effectively you comply with our priorities. It is there to champion good practice, to highlight where reform and where innovation is making a difference in the delivery of services, to celebrate what's good in local government, but also to anticipate where problems may be coming down the line, and sometimes, whether it's through peer challenge or direct government intervention, direct that rightly and early so that we can continue to support you in the provision of the services that you are responsible for and our citizens rely on so much. And it's because I'm a champion of what local government can achieve that I believe that OFLOG will be telling a very positive story. And it's a positive story that I want to build on with your help as well. There's been a rolling program of devolution that's been going on through different coalition and conservative administrations over the course of the last dozen or so years. We haven't always necessarily been able to match the level of ambition shown by some in local government, but I do believe that we have seen through devolution local government stepping up, taking more responsibility, and as a result, winning admirers, even from parts of the political landscape that have been sceptical beforehand. And it's not just mayoral combined authorities. critically important though they are, it's also been the way in which more and more responsibilities are now shifting to those who are elected and accountable and away from bodies, however well-meaning and effective, that didn't have that democratic oversight and control. So, for example, whatever one thinks about the successes or the relatively mixed record of some local enterprise partnerships, shifting those powers back into your hands is a way of demonstrating what I've always believed, which is that economic development is a core responsibility of local government, and that those responsible, electorally responsible in a particular area, should have those economic development tools wherever possible in their hands. And I'm really pleased that we have seen over the course of the last couple of years more and more local authorities stepping up, more and more local authorities embracing the opportunity of a greater level of accountability and control. Delighted that councils like Norfolk and Suffolk have shown the way in embracing that deeper devolution. I'm very pleased indeed that now, as well as South Yorkshire, York and North Yorkshire and West Yorkshire, the East Riding and Hull, a marriage made in heaven in my mind, that the East Riding and Hull are going to work together towards a potential new combined authority as well. And delighted also that with the passage of the Levelling and Up and Regeneration Bill into an Act, that we will now have an East Midlands combined authority with, I'm sure, an excellent mayor, probably from Nottinghamshire, but who is to say, elected in due course. Now, it is also the case, and I don't want to anticipate what the Chancellor may say later this week, that there are individual counties who have worked hard in order to make the case for level 2 deals in order to ensure that when it comes to transport, adult education and other areas, that they can assume those extra responsibilities. Everyone in this room, I think, is probably an advocate of devolution in different ways. Everyone in this room will recognise that the same model won't work everywhere. But one of the things that I have to contend with is that in Whitehall, there are some government departments, no ministers, but some government departments that are jealous of the areas under their control and are concerned that if they give up control, even as you take back control, that we will see service delivery suffer, we will see postcode lotteries and a patchwork quilt. My view is that it's the innovation driven at local government level that will mean that we make progress. But I need to make that case by pointing to the evidence. I think that evidence is there, but to return to the work that everyone in this room does, the work that the LGA does, whatever the colour of its political leadership, and to the work that great leaders like Tim do, I need to be able to produce that plethora of evidence that you all have. And that is why, again, even as I fight your corner for the resources that you need, I also want to be able to highlight the successes for which you're responsible. Often in politics, we think about what we'd like to have, what we need to have, what additional we need to unlock. And it's vital that we do. But also in politics, we need to show a degree of optimism and confidence about what we have and what we can deliver. I know over the course of the CCN Conference and in the conversations that we'll be having in the year ahead, delivery will be at the heart of everything that you're doing, and it's delivery that I want to make the keynote of my time in this office. Thank you all very much. Thank you.
Thank you very much, Michael. Excellent. Right, so we have time for some questions. So there's lots of hands going up. So can we start at the back there? Amanda, I think your hand was up first, and then the gentleman at the back.
Thank you. Thanks, Tim, and thanks, Secretary of State Amanda Hopgood, Leader of Durham County Council. I've just heard about confidence from the Secretary of State. I have to say, after the announcement today about levelling up round 3, confidence is at an all-time low. We weren't told about it. We've again, after round 2, read about it or been advised by the press that round 3 has been announced today with no pre-warning. And we were assured that wouldn't happen after next time. So, Secretary of State, how can we be confident with levelling up when some cities have received 3 bids with 3 constituencies, and an area the size of County Durham with 6 constituencies, 14 towns, has received 1 bid. Thank you.
Thanks, Amanda. Thank you. The first thing to say is that the Levelling Up Fund has been massively oversubscribed. And that's because with £4.8 billion in total, and each individual bid being up to or around £20 million, we simply couldn't fund every bid that came in. So we had to apply criteria which are defensible and objective, looking at levels of need, but also looking at some of the other investment that different parts of the country have received as well. And in the 55 successful bids that we announced today that cover the entire United Kingdom, there were some brilliant bids that we couldn't fund. And that's simply a consequence of the constrained sums and the level of ambition that we've seen. But I would stress that for us, levelling up and support for local government isn't about one fund or one tool at any one time. So it is the case, for example, that individual local authorities within mayoral combined authorities, and thanks to your leadership, of course, Durham is now part of one of the biggest and most exciting MCAs, will be receiving money through the CRUSTs, the City Region Sustainable Transport schemes, which are significantly in excess of the transport expenditure which is available for other areas as well. And I know that it can sometimes be invidious to compare Peter and Paul, to compare Durham and West Yorkshire. So it's natural that each of us as champions for our own local areas will seek to do that. But the Levelling Up Fund, I should stress again, has been overwhelmingly directed towards those areas in the North and Midlands and also the most deprived economically parts of the Southwest, Scotland and Wales, where the criteria against which we judge the need for investment has been clearest. But of course, the work that we do in order to ensure that good ideas from local government are supported better is one that we will continue to take on. My overall view, however, great as the Levelling Up Fund is, great as the Community Ownership Fund is, great as the UK Shared Prosperity Fund is that what we want to do, and this is of course the whole direction behind the Trailblazer deals and deeper devolution overall, is to give those of you in local government a sufficiently generous but also flexible settlement to be able to via money between your priorities rather than having to bid and bid again. When I arrived at the department, the Levelling Up Fund had already been designed. I don't for a moment sort of run away from the nature and scope of its design, but ultimately it's the effective funding of local government itself that seems to me to be the most important thing. So LUF is a very happy adjunct to what we should be doing, which is driving more power, control and flexibility down to the ground.
Yes. Sir.
Thank you. Colin Martin, Cornwall Council. There are 25,000 families on the waiting list for affordable housing in Cornwall and 25,000 homes that are used as holiday accommodation. There are 4 levers that you could pull to fix that problem. One, in April, you tightened up the rules on small business rate relief, so second homeowners could no longer get out of paying their council tax. Could you go further and remove that small business rate relief altogether from short-term holiday lets and use the proceeds to fund affordable housing? Number 2, you've given us now the power to charge double council tax on second homes. Thank you very much. Number 3, you've just introduced legislation to put regulation on the quality of holiday accommodation, but we're not sure when that's going to happen. We'd like to know when that will be in place. But finally, you consulted earlier in the year on the power to create a new category of planning use for second homes to be treated as something different to homes that people live in. That's not something I've seen in the Levelling Up Bill, or the Levelling Up Act. When can we expect to see that new power come into place so that local communities can use neighbourhood development plans to put a limit on how many holiday homes they want in their communities? Thank you.
Thank you. Before going into the detail of what you quite rightly ask, I just want to make a couple of general points. The first thing is that the route to solving our housing problems ultimately lies in increasing the supply of homes of every tenure in every part of the country. And I know that you don't disagree with that. And I think very few people in this room would. And so it's, as a Conservative, I hesitate before looking for new regulation or new ways of increasing tax or new restrictions on how someone can use the property that they've acquired. But as a Conservative, I also believe that communities, in order to flourish, need to have affordable homes for local people who provide the services on which everyone relies, and that if you create communities where too many homes are second homes or holiday lets, you undermine the sense of community that, as a Conservative, well, not just as a Conservative, that all of us in this room, by dint of our belief in public service, believe in. And so that's why we've acted. But before we act, I always want to be sure that we're acting in a proportionate way. So the first thing is, you're absolutely right. Additional council tax powers, I know, welcome in Cornwall, in North Norfolk, in the Lake District and elsewhere, I think are a very, very useful tool. I'll have a look at the business rate relief that you mentioned. If it is the case that we need additional intervention, then of course I'm always open to it. For the reasons I mentioned earlier, I don't want to go too far. On regulation and the use class order, the regulation piece is, as you know, a DCMS, because they're the tourism ministry area, but we're hoping to hear from them very shortly. On use class orders, again, my instinct is to try to simplify the planning system, to have fewer use class orders. But again, the case that you and others have made is a strong one, and the National Planning Policy Framework, I won't preempt it, should be published at the end of this month, not long to go, or the very beginning of next.
Secretary of State, Kay Mason-Billig, Norfolk leader. I know all of us will be watching the television on Wednesday, hoping that there's a little prezi underneath, and I hope there'll be one saying, "With love to Norfolk." But what I'd like to ask you is about the ECHPs. Our professional staff think very long and hard when they look at putting plans in place, but sometimes when we apply the criteria, parents aren't successful. But then they go to appeal, and 9 times out of 10 we lose, and that's very expensive for a local authority. What can you do to help us when it comes to the judiciary and them looking at the criteria we've set and whether we're being fair or not, and make it a bit of a fairer system, please?
Yeah, I think you're right overall. I mean, obviously, I'm guilty to an extent because I was Education Secretary for 4 years. We reformed the provision and support for children with special educational needs, but it's still not right. And as I alluded to briefly when I was speaking earlier, the balance rests with those who've got the time, the money, the assistance to be able to navigate the system. You're in a dreadful position because, as with so many local authorities, there are many, many calls on your resource, and therefore the complicated tribunal system is there in order to try to ascertain who's the most deserving, but often you're not in a position to determine who's the most deserving, simply those who are the most persistent. And I'm not criticising parents because, as I mentioned earlier, all of us would want to do the very best for our own children. So I talked to both Julian Keegan and David Johnston about this, and everyone recognises that we do need to revisit some of the ways in which SEN funding is both allocated to local authorities and also the way in which decision-making is subsequently made with regards to EHCPs and other forms of provision. They understand. I can't preempt what it is that they're going to say, but I don't think anyone here would push back, and certainly no one in government would push back and say, okay, that your analysis is off beam, or that it isn't an important issue to tackle. As I say, I think that the increased prevalence of children presenting with special educational needs is down to a variety of factors, and we need to look at those as well. Will that change over time? Will the situation become more acute or less? But in the meantime, that shouldn't be an alibi for getting on with looking at effective reform of the system.
Richard.
Thank you. Richard Clere, Leader, Wiltshire Council. Wiltshire didn't get any levelling up bids, though 2 of our southern equally affluent neighbours did. But 2 questions for you. NPPF reform. We are expecting changes, particularly around 5-year land supply, especially around if you've got a Reg 19 local plan, having a 4-year land supply, which has been mooted and proposed and pushed hard. When are we going to see the announcements on those, please? Because I am still hemorrhaging to developers who have the whip hand in this system at the moment. We were told we'd have them in November. We desperately need them. Moving on to devolution, I wonder if you can give some reassurance that DLUC officials will consider footprints that we as local authorities consider sensible when looking at devolution footprints, as opposed to telling us what the footprint we might consider devolution to operate is, and then letting us try and get on with it with councils that aren't really necessarily able to take those steps.
Two very important points. On the MPPF, as I say, I hope it's at the end of this month or the very beginning of next that we'll be able to publish it. You're quite right. For those people who've got a sound adopted plan, then it will be the case that the teeth to demonstrate the 5-year housing land supply that has existed in the past will be blunted. But an important point, which I think is understood here by everyone who's been involved in planning, is that having a plan is the best protection against the presumption in favour of sustainable development. And there are some who understandably held back plan making because they want to take advantage of the new provisions, but really the very best thing that every local authority can do, as I know Wiltshire has, is to have a sound plan. On the point about devolution, there can sometimes be a tension between what is viewed as the optimum economic area for a devolution deal and the strength of feeling amongst local people and the sense of attachment and devotion that they have to a particular area. And all forms of local government organisation and reorganisation are bedeviled by, it's not always the case, bedeviled by a tension between the sense of familiarity, accountability, and a particularly recognisable geography, and then some of the economic benefits that can be brought if you bring in other local authorities. So we have this issue at the moment with Devon, Torbay and Plymouth. I'm not criticising anyone. Devon and Torbay very keen, Plymouth reluctant. In a way, Devon and Torbay going ahead without Plymouth is a problem, and we have a similar issue in the East Midlands where Derby, Derbyshire, Nottingham and Nottinghamshire, so 2 Labour and 2 Conservative authorities, are working very well together. Leicestershire want to join. Leicester, under its very individual mayor, less keen. We want to move ahead. I think in due course, Leicester will, see the benefits of the leadership that the East Midlands Combined Authority can provide. But I get it, but it's not always easy to have the perfect geography there. What time is it now? Oh, yes. Another 5 minutes. Another 5 minutes.
So I think we just get another couple of questions in. So, yep, you got this microphone there.
Thank you, Secretary of State. Talking of Leicester, I'm Jonathan Lester, but I'm leader of Herefordshire. So just to clear that up. In Herefordshire, we are desperate to deliver those houses that we all want, but we're battling with the phosphates issue. And we have a wetland scheme, and we want to invest in more wetland schemes. But the problem is obviously talk about not having to demonstrate nutrient neutrality is set hairs racing. We're worried now that if we're going to invest further and then the situation changes, are we going to be in a situation where we've invested in something that we didn't need to, and we run the risk of saying to developers, sorry, you've paid your credits, but and will they want a refund? So there's that uncertainty there that we've got. I'm just appealing to you to give us that certainty so we know how to invest so we can get those houses built. Thank you.
Look, absolutely. I think everyone here knows that we brought forward legislation to try to deal with the nutrient neutrality question, in essence by exempting residential development from the Habitats Directive insofar as it related to nitrates and phosphates. I believe that was would have been a quick and effective way of unlocking significant development, up to 100,000 homes. But the House of Lords took a different view. I respect that. So we now have to think about how we can help deliver those homes. As you rightly say, before that vote, quite a lot of work had gone into mitigation schemes. We will be seeing more in the next couple of weeks about financial support for those mitigation schemes in order to ensure that they work. My approach is don't make the perfect the enemy of the good. The perfect would be trying to get that legislation through again, but just because of politics and not believing anyone, we wouldn't be able to, I think, in time. So therefore, we're going to go to Plan B, which is improving the working and providing additional support for those mitigation schemes for precisely the reasons that you mentioned. You know, one of the things that everyone in this room will appreciate is that people in local government are sometimes painted into a corner as NIMBYs. In fact, one area where local government spoke with one voice was in its desire, your desire, to see this issue tackled because of your desire to deliver more homes for people who need them.
Roger, if yours is a very quick question, we can get Sarah's in. So if you could just keep it short, please.
Thank you. Roger Goff, Leader of Kent County Council. Secretary of State, you talked about a number of the areas of spending pressure. You didn't say very much about children's services and placement costs in that.
Yes.
How can we address that, particularly given that the White Paper seems to take these things at a rather slower pace and scope than the original Josh McAllister review?
Yeah. Roger, you're absolutely right. And again, you know, one of the problems that we have is an increasing number of children who are in homes that are run by business interests that don't necessarily put the children first, but are thinking in economic terms. This is a real problem. It's a problem that I've shared with David Johnston, because again, you know, when children are taken into care, there should be not a hierarchy of options, but a range of options. One of the problems that we have is, have people been intervening early enough? Is it the case that there are a sufficient number of adoption placements? Is it the case that we're supporting foster carers appropriately? Is it the case we're supporting kinship carers appropriately? Because all of them are better alternatives than a child ending up, normally after other placements have been tried or may have broken down, in a residential children's home. But by definition, there are some children who will be in them, and they will often be in areas like your own, where you will find that there are some parts of the your local authority area where the accommodation is relatively cheap and relatively close to London, and the access of relatively cheap accommodation close to London means that you're used in that way. It's not that Kent doesn't want to play its part in helping, it's just that some of the people who are playing that role are not necessarily the most admirable figures in the provision of public service. One other thing that I didn't mention, and should have done, of course, and it's principally, of course, a burden borne by borough and district authorities, but it is shared by all of you, is, of course, the dispersal of asylum seekers. And we have responsibilities towards asylum seekers and towards people from Afghanistan and elsewhere, but we need to make sure that even as we're saving money, as people move out of hotels and have their cases effectively resolved, that we also recognise that everything from the educational needs of unaccompanied children through to the broader pressure on housing, as I say, it's borne by others in the local government family, but it's not unique to them, is also recognised as well.
And the last question from Sarah. Thank you.
Thank you. Sarah Calkin, Local Government Chronicle. And apologies, this question doesn't relate to a county, but last week at Prime Minister's Questions, the Prime Minister said Kirklees Council wasn't fit for purpose. Today, your department has awarded them, I think, something like 60 million in levelling up funding. So I just wondered, do you disagree with the Prime Minister?
I never disagree with the Prime Minister. But I think the Kirklees project, if I'm right, I think it's a railway project, it's a transport project, the Penistone line. So yes, it was the case that Kirklees Council wanted to see that funding, but I think it was also the case that Kirklees MPs, Mark Eastwood does a brilliant job, Jason McCartney does a brilliant job, and also Miriam Cates, who's obviously in South Yorkshire, not in Kirklees, were behind that project. Not for me to add to anything that the Prime Minister said, but I think that it's about the wisdom of improved transport links in that part of Yorkshire rather than anything else.
Michael, thank you very much. I've had a very full set of answers. We're going to look forward to those presents being opened on Wednesday, being unwrapped, and let's hope Christmas comes early, at least for local government. So, Michael, thank you very much indeed.
Thank you.
It should tell you up here in a minute which rooms you're in for your group meetings, which we'll head to straight away. Thank you much.
See